The IT, can you bring up my presentation? And then, thank you very much. The Coordinating Minister of Health and Social Welfare, Professor Mohamed Ali Pate, ably represented by my director, my immediate director, who I report to, Dr. Beyere Mukaire. Please let me stand on the already established protocol, and then I quickly do speak to some of the slides. Young people, are we here? Thank you very much. It's good to know that you are here. So, looking at me very well, you also know that I'm very young. Anyway, I'm very young at heart. So I'll be speaking to some slides here just to stimulate our appetite on why the young people should understand that we cannot do things alone. We need to work as a team, as partners. So the Federal Ministry of Health have been doing so much for the youth, for the young ones in our country. And we'll be speaking to some of this just for you to see some of the things we'll be doing, and others you can read them up. So I'll be speaking to you based on these 4 points. This is the outline. Next. Very good. So, position statement. The Federal Ministry of Health and Social Welfare is a world-class government institution that ensures a healthy Nigerian through the provision of effective healthcare facilities and humanitarian services. So the ministry for me is for you, is for all of us. And this is the world-class statement. And you can see the leadership of the ministry that are working tirelessly in order to make sure we deliver on this statement. The 4-point agenda, there are so many agendas for us to grab with. But the Coordinating Minister of Health and Social Welfare and the management team decided that if we grab 13 agenda will be too much for us to hold. Let's go with 4 points. And these are the 4-point agenda. If you go to the FMO site, you will also see this particular 4-point agenda. Our goal is to save lives, reduce both physical and financial pain, and produce health for all Nigerians. By so doing, we will now improve governance. We will go on to ensure health security for Nigerians. We will unlock healthcare value and also improved population health outcome. Next. IT next. Okay. So the Federal Ministry of Health and Social Welfare under the current administration is positioned to building a resilient, equitable, affordable, and quality health system for all Nigerians through how? Strengthening health sector governance and institutions, smart and effective regulations, digitization, enhancing citizen voices and our responsiveness, and making sure no one is left behind. And that is why we are here for the youth. Also, through improved funding for basic healthcare facilities. And the ministry is ensuring affordable and quality health system to improve health outcomes for all by delivering preventive, promotive, and curative services at primary healthcare and hospitals. So funding. This is one of the way we are going about it. The National Health Insurance has been reformed to an act to ensure health security and reduce out-of-pocket expenditure for all, including the adolescents. So some of the high-impact deliverables, what the minister is being tracked upon, among all things that the president of the federation wants him to achieve, we are running on the following. Improve immunization coverage. How? Achieve a 20% increase in coverage of immunization within the next 4 years. This is one of the priorities of the minister, and it's being tracked on that. Another one, improve maternal and child health. Reduce the maternal mortality rate by 20% and the under 5 mortality rate by 50%. in 4 years. Some of the adolescents that are here will now ask, how did this one concern us? It concerns all of us because adolescents, especially the young adolescents that are pregnant, they also contribute to the maternal mortality age if they don't have sort out their delivery in a health facility. Then the babies they also give birth to also contribute to newborn deaths that also we record. So you can see that it concerns all of us, and we need to speak to ourselves. Improve health, human resource for health by training 120,000 health workers to add value. So these are some of the indicators, the global indicators that adolescents generally are being tracked upon. Adolescent fertility rate is one of them. Then sexually transmitted infections is another one. Contraceptive use among adolescents is another one. Marriage and childbearing, another one. And health service utilization. The idea, we looked at the 2021 multiple indicator cluster survey and also look at the 2018. But let me go to the 2023. So this at the 2023 and 2024, adolescent fertility rate, 77 births per 1,000 women aged 15 to 19. Young adolescents, 15 to 19, 77 births per 1,000. That is huge. And you can see why we are talking about trying to address those other performance indicators that we enumerated earlier on. It means 50% of Nigerian females aged 15 to 19 have been pregnant and 11% have already given birth at that age. Then contraceptive use. 3% for unmarried adolescents, modern contraceptive prevalence rate. 6 to 7% for married adolescents, modern contraceptive prevalence rate. Then marriage and childbearing. 90% of girls aged 15 to 19 are already married or in a union in our country. So it means there's so much for us to do. And then health services utilization in terms of ANC services, 63%. Now, we just decided to look at it. Then look at the teenage pregnancy. The NDHS records that 15% of women aged 15 to 19 have ever been pregnant. You see why we are here, to make sure we contribute and also add our voice to this. 11% of young women have had a live birth, and 2% of young women have had a pregnancy loss, and 4% of young women are currently what? Pregnant. That means that we need to work harder and move faster than we are doing. Now, with this, we decided to say, okay, let's think outside the box. What are the identified vulnerability issues faced by young adolescents in our dear country? Early childbearing stood out. Unplanned pregnancy, another one. Child marriage and forced marriage become a challenge because it's not the will of the child, but they are being forced to marriage. It's a huge challenge in most parts of our country also. Physical abuse is another one that they face. And then gender-based violence. Rape also occur among adolescents. Then higher maternal mortality, as already evidenced and stated. Unsafe abortion, because some of them are so shy that they cannot go to the health facility. Sexually transmitted infections also contribute to some of the problems they face. Substance abuse and mental health issues, so rampant among adolescents. Then, trafficking and exploitation. Some of them actually fall into trafficking and exploitation. It's not for their own will, but they are being forced to this. Technology facilitated gender-based violence. Wow. We're already in digital age. Many adolescents already embrace it. But there are so many adolescents also that are suffering one form or the other from the technology facilitated gender-based violence. Then sexual exploitations and abuse. All these are happening. Cyberbullying and internet addiction. So many, and these are just few among the other problems that adolescents face. So we decided to, at a programmatic level, from the lens of program, from the ministry, what is the ministry doing that actually targets adolescent interventions that can help to address some of those things that we have already pointed out? One, provision of adolescent and youth-friendly health services. So government is working hard to ensure that the normal hospitals and facilities that are beautifully established that are in our cities and towns, adolescents don't feel comfortable to access them for services. Therefore, adolescent corners adolescent clinics should be integrated among already existing facilities so that they can quietly walk there and access services. 2, peer-to-peer. So we are also addressing this because we know that it cannot be done alone. But when adolescents talk to themselves, like in this forum now, when you heard from the champion of the youth, that stimulates you better. So we want people like among adolescents speaking to themselves, talking to themselves. Youth health education for both in school and out of school. And then the comprehensive sexuality education under the West Central Africa commitment. So these are some of the things, because it's not happening only to us as a country, but regionally, when we take West Africa as a country, at the West and Central Africa commitment, the Ministers of Health and Ministers of Education have already signed a commitment with other countries, over 25 of them, to ensure that the health issues and SROH of adolescents, the sexual health rights of adolescents, are earnestly and quickly addressed. Linking schools to health facilities under the West and Central Africa commitment. So efforts are on, and Minister of Health and Minister of Education, in partnership with our partners, are working fast in order to make sure that when there is a school, then they should be identifiable. Either they have a clinic or a sick bay, or based on the population of the people that are in that school, there should be a facility that if something happens within the school that cannot be addressed, they should be able to take that adolescent or that school people to that particular facility for ease so that they can save lives. Then strengthening access to adolescent sexual and reproductive health under the EU SERA. That one is already ongoing, and it's something that all of us are working around the clock. And some of you, if you go to the site, you will see it. Then quality of care. Quality of care. We are not just interested in making sure services are available. We also want to make sure the structurally, the place should be conducive for adolescents to access service. And the people providing the service should be skilled enough to be able to provide the kind of service that we meet, so that at the end of the day, both the provision and experience of care will be optimal for the adolescents in our country to benefit from. If you want to also get more information, you can visit the FMOH site, because many of you, by now as I'm talking, some people have already entered to confirm, www.health.gov.ng. So you can access more information from there. So what are the initiatives that the current government and Minister of Health is running with? One, Nigeria Health Sector Renewal Initiative. By this, adopting a sector-wide approach to ensure alignment among partners on national health priorities. What do we mean by this? It means, unlike before, when partners come, they do whatever they want to do, choose any part of the country and run with, put resources there and say we are supporting Nigeria. It will not be so again. The ministry is interested that all of us come together in one basket, such that we'll be able to say, the resources are already meager, so we need to manage them better. Identify, prioritize our challenges, and then the meager resources, drive it to there. So that you don't have duplication and wasting of financial resources and effort by partners. They are well managed. So partner is working here, the other one can take the next place, so that the population is fully covered, adolescent inclusive. Integration of adolescent youth-friendly health services into PHC. This is ongoing. Another initiative, accelerated action on the health of adolescents, the AHA, which is also ongoing, and then we've even now trying to make sure we work with AHA too. The SARA, strengthening access to reproductive and adolescent health in Nigeria. That is another one that is already ongoing. And then MAMI, to encourage antenatal attendance for pregnant adolescents and order to reduce maternal and under 5 deaths. Because in MAMI program already is to make sure it's targeted at the neonate and then the maternal. But the young and pregnant adolescents, we don't want them to die. So we are also working hard to make sure they have what we call young mothers corners or young mothers clinic, where they can access services as quick as possible. My time? Okay, because you are working towards me, I thought it's my time. So in order to get all this done, so the ministry is looking at this from this area. The minister restructured the entire coordination platform. Now, coordinating minister is up there. And then we now have the swap steering committee that is there. We that are here, the RAMCA, swap TWG, we are now also coordinating. So if you look at it along the line, this is a more detailed graphical, but the whole idea is that we don't want duplication and multiple steering committees in the country any longer. The minister wants to ensure that he is sitting at that point and everybody reports to him. Why? Because he wants to hear from everyone. He doesn't want passing the message through the third party. He wants to hear it directly. That's why all these committees that are here, they are actually reporting to him directly. Now, partnership and collaboration. What is the ministry actually doing in this regard? One, the ministry tends to work with the MDAs, Ministry Department and agencies, in order to make sure we run with things. And you can see that Ministry of Youth is here. Women Affairs, we are working with them in the areas that pertain to them, gender-related issue. And other ministries in country, one ministry alone cannot do it. One agency alone cannot do it. And one department alone cannot do it. We need to come together. So there's cross-working among MDAs. The states, we cannot do it. That's why you can see that the states like Kwara and even Rivers State and many other states, they are there. Federal ministry is there. The subnational is there. So you must work as a team. So we work closely with the states. And I can't count the number of times me and the Commissioner of Health, Kwara State, have met in the past few days. It's like we're always going to the same area, all because of the work. Thank you, Commissioner, once again, for being here. So, multilateral. We also work with our UN, World Bank, and all the others. Then, bilateral, you said, that the youth-led organization, your own organization, the youth-led organization, as many that have written and as many that have decided to talk to us or contact us at the Federal Minister of Health, under the leadership of the current Director of Family Health, our doors are open. So many youth can attest to it that anytime they send a message, one of us will always be there to make sure we participate in their program. Why? Because we know that we are working for them. They are not working for us. We are working as a team. And that is why youth-led organizations are very prominent. Implementing partners. The faith-based organizations, professional organizations, all of them were working together. Then, please kindly help me change the slide here. Thank you. What the government is doing currently, improve policy environment. National policy on adolescent health development, clinical protocol, national guidelines on youth-friendly health services, so many policies. If you go to the site, you will see some of the policies. Why? Because they are the enabling laws that will give us the leverage and the free space to be able to work without any hindrance, both national and subnational. Then capacity building for health providers on youth-friendly health services. This is ongoing, and we are being supported on that. Improve coordination and SRH for adolescents through the Adolescent Health Development Technical Working Group, which is now going to be subcommittee. Then creation of budget line for adolescent health interventions in country at national and subnational. This is what we are promoting. Then disaggregation of adolescent health data. Disaggregation of adolescent health data. So add your voice as adolescents. We want your data disaggregated. We want to make sure when we are looking for adolescent health data, they are all over. Not both national and subnational. But at the same time, we are working hard to make sure this is done. And we are working hard with our health planning, research and statistics department to get this sorted out. Integration of youth-friendly health services into nursing and midwifery curricula, so that when they are coming out, they already have it and they can provide these services as optimum. Integration of CSE into school curriculum, which is family life HIV education. This is also ongoing. But please kindly help me change over there. IT. Thank you. IT. Change that slide. Next slide, please. IT. Okay, good. Thank you. So challenges are there. So even at the national, subnational, and at the community level, there are challenges. So what are the challenges that are actually common? Poor domestication and implementation at the subnational level of national policies. Because from NCH, National Council on Health, decisions are taken. The states should adopt and adapt some of the family planning and policy documents that are released, and also establish the Department of Family Health in the states. Not all states have done that. So there are some things that are also limiting them, probably finance and a host of other political will and all that. But many states are working in that area. But we see it as a challenge at the national level. Because we would have loved just at the finger's tip that every state should just adopt, but it doesn't happen like that in real life. But that is our hope. Then lack of budget line and non-release of fund for AHG programs at subnational. Sometimes they may budget line for some of them have not even established a budget line. The partners are still working hard to make sure they support us. Slow establishment of family health department across. Then program verticalization and working in silos by some partners. Partners that are here, we want to repeat and repeat again in the presence of the representative of the minister, that we don't want partners to work in silo. We don't want people to run in silo. let us know that you are working so that we'll work together as a team. It's better like that. Because they say, if you want to go far, you work together. And want to go fast, you move alone. So, and if you move alone, sometimes you crash. So thank you very much. The poor translation of adolescent-focused research into policy. The way forward are this. Let me just pick one of the way forward because the person timing me is already standing beside me, and I'm not comfortable. So, one, robust engagement and inclusion of young people in the design and implementation of adolescent health development at all levels. So from now on, we'll be doing it, and we want it also to go on. Robust engagement. Adolescents must be there. We will plan with them, and then implement with them, and evaluate with them. I will stop it there. Thank you very much.
Thank you very much, sir, for that very insightful information. We truly appreciate that. While that was going on, some very special dignitaries walked in and would love to recognize them. We start with the recognition of Dr. Vincent Nwachuku. Please put your hands together for him. He's already upstage. He is the Director, Medical Service, Rivers State Ministry of Health for the Permanent Secretary, Rivers State Ministry of Health. One more time, please put your hands together for him. Thank you very much, sir, for being here. We truly appreciate your presence. Also, one of my very inspiring friend and mentor in person of Dr. Betty Agala. She also walked in while that presentation was going on. She wears many caps. She's Executive Secretary for River State Health Protection Program and also the National Coordinator of Medical Women Association of Nigeria. I must say, Dr. Betty is doing a whole lot. You should know her and you would see the definition of capacity. It's good to have you here. Thank you very much. We also have the presence of Professor Faith Diogo. Please put your hands together for her. Thank you very much, ma'am. We're honored to have you here. Representative of the Center Leader African Center for Excellence in Public Health and Toxicological Reports, University of Port Harcourt. One more time, put your hands together for her. We appreciate your presence and are glad you made it. Right about now, ladies and gentlemen, we will now hear some goodwill messages from some of our esteemed guests and partners, and each and every one of them are playing a vital role in shaping adolescent health and the well-being of young people across Nigeria and beyond. First, we'll hear from Indifreke Andrew Essien. Please put your hands together for him as he comes up stage. Okay, can we get some persons to please assist, some guys? Okay, she'll make her speech from there. Next will be a message from the Permanent Secretary, the State Ministry of Health. Kindly get ready. We'll then welcome Professor Jonathan Klein from the International Association for Adolescent Health. That will be followed up with some goodwill message as well from our valued partners. Ladies and gentlemen, please put your hands together for Indifreke Andrew Essien as she gives her goodwill message.
If that's for me, well, that's good. Now, because of the responsibility that I have with a core demographic, I want to teach you how to clap in sign language. So please help me raise your right hand, raise your second hand, and then shake. That's how to clap in sign language. So please clap for yourselves. Somebody was still tempted to do Thank you very much. You did amazing. My name is Ndifreke Andrew Essien. Everybody calls me Freki. And while I wear many caps, my goodwill message is a representation of people that we refer to as one of the most vulnerable in society, and that is persons with disabilities. Persons with disabilities come from different walks of life. They are located in different places. And even within the persons with disabilities, we have children with disabilities, women with disabilities, and young persons with disabilities that are assigned, even within that demography, as most marginalized. Now, in the course of this conference and standing on existing protocols, I'm really excited Because in this 4th national conference, one of the indicators of progress and development is the fact that Sayphin and her partners have ensured that this conference is as inclusive as possible. Let's give them a round of applause. Being intentional about engaging and intentionally involving young persons with disabilities. We have them here in the house from different places, tertiary institutions and secondary schools participating in the program. Very intentional involvement of the young persons. Now, why is this critical for this conference? A lot of times, the approach to development makes us to see disability as a special case. But I tell people that the world doesn't have a special place, as it were, for persons with disabilities. We work together, we integrate together, and it has become very important that when you approach disability and its related concerns, that you have an integrated and an inclusive approach. The theme for this conference is very crucial because of the age that we live. Pressure for a young person is in the digital space. Approach, think about the together. Now, as I bring and how that intersectionality that happens with a young person and disability matters. The theme is the evolving adolescent and youth in digital age, building resilient young people in a changing world. The world of 10 years ago is not the world we're experiencing today. The world that we're experiencing is a world that needs every voice to count in every space. And that is why in building resilience, whether it is in mental health, whether it's in issues of sexual reproductive health, whether it's in issues of general wellness, it is important that resilience is built in young persons with disabilities. In case you do not know, when you have an existing disability, there are many things that can come into place as challenges. The biggest for us is the issue of discrimination. Not because you do not have abilities, but it is easy for people to judge a book by its cover or judge a book by what they do not understand. Discrimination is one of the core barriers that a lot of young persons with disabilities have when it comes to accessing digital spaces, accessing and evolving on their own rights. So, to wrap up this goodwill message, I want to say thank you to Sayphin for ensuring that this conference is intentional. What I know is that as the conferences progress, accessibility will even be better, and other things where we have young persons with disabilities as speakers, young persons with disabilities as panelists, and young persons with disabilities participating in the different tasks that were assigned, like the theme song challenge, the speaker challenge, keynote challenge, because they can. To wrap this up, you that is sitting in your space, our dignitaries on the stage, our dignitaries sitting out there, even you as a young person, you have a role to play in ensuring that your counterpart is carried along. You have a role in ensuring that barriers are intentionally removed, not because of pity and not because it's we've passed that stage, but simply because that young person with disability has a right to thrive in every space. So on behalf of all the young persons with disabilities in River State and in Nigeria by way of extension, we say keep being intentional about inclusion. You and I can make a difference. Thank you. They got it right.
We can do this.
Awesome. Thank you
very much. Thank you very much, Ndifreke. I forgot to mention, she's also the co-chair for the local organizing committee for Sayphin Garden City 2025. So can we give her another round of applause? Thank you very much. Up next for a goodwill message, ladies and gentlemen, it will be coming from Dr. Vincent Nwachuku, the Director, Medical Service, River State Ministry of Health, for the Permanent Secretary, River State Ministry of Health. Can we please put our hands together for him? We're not clapping. Thank you very much.
Good morning, distinguished members of the High Table, representative of the Honorable Minister, every other person on the High Table, my NMA Chairman, Dr. Diamond, you're welcome. The Reef Chief, yes, Dr. Veti Agala, you're welcome. every other distinguished ladies and gentlemen in the hall, distinguished members of the press, ladies and gentlemen. Before I give my goodwill message, let me bring the apologies of the Senior Special Advisor to the Administrator on Health, Professor Chitro Oluwini, who would have been here, although he had promised he will be here before the close of the day. He has sent his apologies. It's very wonderful to see youths gathered like this, and then with the team, the evolving adolescent and youth in a digital age, building resilient youth, building resilient young people in a challenging world. I believe that this team is apt because of the way things are going in the world. The world has become a global village where you can reach anybody digitally now. AI is taking over every other thing we are doing. But it's wonderful to note that we have wonderful youths like this who are not engaged in the vices that is going on in our society these days in terms of involving themselves in what they will call Yahoo, involving themselves in drug addiction. But I've decided to gather in Port Harcourt, Rivers State, for an event like this. That is wonderful. Please, can you put your hands together for yourselves? So on behalf of the Ministry of Health and Rivers State Government, I wish you a very eventful program. I know it's a biennial event. I wish you a beautiful stay in Port Harcourt. I wish you well in all you're going to do. And I believe that at the end of this program, there must be a take-home lesson that all of us will learn. And as a government and as a ministry, we pledge to also partner with NGOs and the association. Professor Mosiva, I thank you so very much for what you're doing. I thank you very, very, very much because you have been very wonderful. You've been very awesome. So on behalf of Rivers State Government, I welcome you and I wish you a very peaceful and wonderful deliberation in Port Harcourt. Thank you and God bless you.
Ladies and gentlemen, one more time, put your hands together for Dr. Vincent Nwachukwu, the Director of Medical Service, Rivers State Ministry of Health for the Permanent Secretary, Rivers State Ministry of Health. Can we hear our hands together? Thank you very much. If you cannot do this, this is also accepted. So can we put our hands together one more time? Thank you very much, ladies and gentlemen. A very special person just walked in while that goodwill message was going on, and he is Dr. Aloni Alali. He is the Chairman, Association Public Health Physicians, Rivers State. Can we please put our hands together for him? Thank you very much for being here. We're still on our goodwill messages, and up next for their goodwill message is Professor Jonathan Klein from the International Association of Adolescent Health. Please put your hands together. She has a representative here. Please put your hands together.
Good morning, our distinguished guests, ladies and gentlemen. I'm not Professor Jonathan Klein, he's a he. But I'm here giving this on his behalf. Usually he prefers to do this by himself, to do this by video conferencing, but this year he was unable to put this together, so I'm doing this on his behalf. And so it's always a pleasure to give a goodwill message at the Nigeria Conference on Adolescent and Youth Health and Development. The International Association for Adolescent Health is a global association of adolescent professionals, youth, and champions with a similar vision as Sayphin, which is to ensure that our adolescents thrive now and grow and develop into well-rounded adults. Indeed, these are challenging times globally. However, there are also several opportunities for us as professionals and youth advocates to contribute to the health and development of adolescents. Incidentally, Professor Fatusi was our immediate past Vice President for Sub-Saharan Africa, and during his tenure, he jointly organized the very first African Adolescent Health Conference, which held along with the second Nigeria Conference on Adolescents and Youth Health in Nigeria in Abuja, Nigeria in 2021. I'd like to use this opportunity to invite you all to our international conference taking place in Montego Bay, Jamaica from November 6th to 8th, 2025. Finally, I'd like to encourage all participants to engage fully in this conference and going forward to resolve to be very intentional in their work with and for adolescents and young people. As we all know, the digital space is here to stay. We must mind the opportunities and work together to address the challenges. On behalf of our association, we wish you a fantastic conference. I hope to see you in Jamaica in November 2025. Thank you.
Thank you very much, ma'am. Please put your hands together for her. Up next is a goodwill message from Dr. Andrew Karima. He's the program's coordinator and head of office from UNFPA. Can we hear a round of applause for him?
The Honorable Coordinating Minister, Minister of Health and Social Welfare, ably represented here by our dear Director of Family Health Division, the Honorable Minister of Youth and Development, ably represented here, the Commissioner, Minister of Health, Kwara State, and also Secretary of the Health Commissioners Forum. Allow me to stand on the already established protocol. I will deliver this goodwill message on behalf of my resident representative, Dr. Gifty Adiko, who couldn't be here with us today due to other equally important events that are taking place at the same time. It is with great pleasure that I join you here today for the opening of this fourth Nigeria Conference on Adolescent and Youth Health and Development organized by Sayphin. In UNFPA, we take Sayphin as our brainchild. I mentioned this yesterday, something that is really dear and close to our hearts. This year's theme, that is the evolving adolescent and youth in a digital age, building resilient young people in a changing world, could not be timely. Earlier this week, we were celebrating the International Youth Day. So big things are happening for us young people in Nigeria as now we are here for this Sayphin conference. We are living in a rapidly changing world where digital information is reshaping economies, societies, and even the way young people interact with health and development systems. We have a lot of technological innovations now. We have AI, deep space, ChatGPT, and even social media. And as stakeholders, it is out. This transformation creates opportunities for all young people rather than dividing them. This conference provides a unique platform for us stakeholders across the government, the civil society, the academia, and the private sector, as well as development partners, to share evidence, exchange experiences, and forge partnerships that place young people at the center of the policies and programs that we are supporting. Adolescents and young people as a whole are the core of our work at UNFPA. Our commitment to safeguarding the rights and well-being of all the youths are boldly embodied in our 3 transformative results. 1 being ending preventable maternal deaths, number 2 being ending unmet need on family planning, and number 3, very important, is eliminating gender-based violence and all other forms of practices, including female genital mutilation, child and early forced marriages that are harmful in our societies. Mass for maximizing the demographic dividend in Nigeria. And we remain committed to advocating for the rights of the young people, empowering them with knowledge and skills, not only to protect themselves, to economic and social transformation in Nigeria and the world, and fostering innovative challenges such as misinformation, digital exclusion, and online exploitation. Therefore, with the use of this technology. As UNFPA, we are proud to stand with Sayphin and all stakeholders, especially you, the young people here today, to strengthen youth responsive, both within the development context as well as in the humanitarian context, like the Northeast. Our conversations will have people here with us, and we engage with them meaningfully in the decision making and ensure that the investments that will be moving forward will be bringing solutions that reflect the realities and their aspirations. On behalf of my resident representative at UNFPA, I congratulate Sayphin as well as the local organizing committee for convening this very important platform, and I commend all conference, inspire bold ideas, drive impactful collaborations among us, and set the stage for lasting progress, building resilient young.
Thank you very much, sir. Can we see and hear an applause? Thank you. UNICEF, ably represented by Dr. Anslem Odo, Chief of Rivers Field Office. Can we give an applause to him as he comes up stage?
Good morning. The chairman of the occasion, the Honorable Minister for Health and Social Welfare, the Honorable Commissioner for Youth, ably represented, the President of Sayphin, the Honorable Commissioner for Health, Kwara State, third nation at the high table, my colleagues from UNICEF, and my able colleague, the young people, don't mind the white hair. I'm here and I bring greetings from her from Abuja. It is my honor to present this goodwill message at the 4th Nigeria. See this important gathering take age and building resilient young people in a changing world. Today, we come to recognize the potential of technology to empower young people, but we also acknowledge the risk and vulnerabilities that come with adolescents and young people in Nigeria. We've shown this commitment by supporting the participation of over 100 young people who engage in thought-provoking discussion, share knowledge, and explore solutions to promote the health and development of adolescents and young people. I encourage you to actively participate, share your experiences, and learn from one another. I would like to express my gratitude together to make a difference in the life of young people and the life of young people among us, and to ensure that they thrive in a rapidly changing adolescent and young people among us. Thank you, and thank you very much for bringing this conference to.
One more time. We agree that everybody is a youth for the youth's life. Gentlemen, for another goodwill message is a woman that spoke brilliantly and inspiring yesterday of girls.
Ably representing Honorable the President of Sayphin, be from Kwara State, and we are both seated side by side. So my sister, my blood, good morning. I also want to recognize Magica, UNICEF, UNFPA. Please permit me to stand on already established protocol. which reminds us clearly that there's a lot we can do together, not alone, but together. This gathering reminds us all with the knowledge, confidence, and forward to the ideas and partnership and innovations to take a step back and reflect. The young lady yesterday told us to listen and to reflect. The silence on either sides of the room speaks volume. Government, parents, adolescents yourselves, policymakers, the time is now. There's no other time. It's now. This generation is ready for us. Are we ready? And they are hungry. I like that. Are we ready? Awesome. The generation is ready. They have confirmed that. They are hungry for opportunity and eager to shape a better and unique future for themselves. And so I'm asking us, and as a matter of urgency, are we ready to match what they bring on board? Are we ready to match their courage with our action, their hope with our commitment, and their potential with our investment? And I look forward to fruitful engagement, strategic partnership that would yield better fruits for our adolescents. Thank you very much.
Thank you. Finally, on the goodwill message, we'll be calling up stage Dr. Diamond Tamunokuro.
Thank you very much. The chairman of today's occasion, because of the high table, let me stand on existing protocol. Now, in this country, there are youths and there are youth. Youths are an ill-defined group, maybe ranging from 16 to 75 as youth leaders in quotes, and sometimes cause all sorts of troubles. But the young people that are here to change the story are the youths we are here to celebrate. If you know that you are more than and clapping. So if you know you're among those young people, can you do like young people clap? Can you stand to your feet and clap for yourself really? Gather is when we go. And I want to believe, am I speaking your mind? The story has been fairly the same, probably since you were born. But we came here to tell you that it's now your turn to change the story. The Ministry of Health has told you what they have done and what they are doing. UNICEF has said what they have done and what they are doing. Perhaps I'll end up saying what we have done and what we are doing. But it doesn't change the story until you, seated down here, decide that the story will change from today. And all we are doing today is to challenge you to take up that responsibility and tell us that where there are no doors, I'm going to create a door for myself. That where there are challenges, I'm going to create solutions. And where I see normalcy, I'm going to innovate and create a way, a new story, a shift from the normalcy and what will bring the desired results that we all want to see in this country. Young people, the time to act is now. The talk has been so much, but we want to see what you can bring on board. And when we see that, I'm sure that everybody here will embrace it. And that will bring the change that we desire. It's time to act. Welcome to Port Harcourt. Thank you very much.
Thank you very much, young people. The time to act is now. And so we are going to move on very quickly because of our time. I would be bringing up on stage, and I would like that we put our hands together, especially the winner of The Voice Nigeria 2023. Again, the winner. And he's going to be joined by the winner of the team song competition, Ziggy. Please put your hands together as we once again welcome her, Jason.
Here, please.
Good afternoon, everyone. Please, can we celebrate the organizers of CK? He's here. Please, let's put our hands together for him. Okay, just before we start, we want to teach you the song very quickly. The words are simple. Ziggy is a rapper, by the way, so I would be doing the chorus. The very best in the internet space would help you navigate. Very simple. All right, DJ.
Love, Ziggy. So we all know that the internet space can be addictive, especially when exposed to things that are explicit, peer pressure, and sometimes depression. Fit to make a man sit down, start to reason, but as youths, it goes deeper than that. There's a lot we can achieve, and we all know the fact. It depends on what you want, and what's in your mind is a weapon, and we all got to use and right, cause we all can relate and inform for people who knows how to communicate. It dey easily help you, make you blend, cause there's a lot of nice things you can learn. Help you discover yourself and plan your life to the very best as well. New gen of the digital age, three best on the internet space. We have the whole world in our palm, and Sayphin will help you navigate. New gen of the digital age, three best on the internet space. We have the whole world in our palm, and Sayphin will help you navigate. Song get chorus and Sayphin with the hook. When I Sayphin at the hook, and it gives everybody a sense of expression. Build society blend, cause there's a lot of nice things you can learn. I help you discover yourself and plan your life to the very best as well. Let's go! New gen of the digital age, new gen of the digital age, three birds on the internet space. We have the whole world in our palm. Internet space. We have the whole world in our palm. And Sayphin will help you navigate. Say Sayphin. Yeah. You know what time it is.
Put your hands together for Ziggy. You're not clapping for them. You enjoyed it more than you're clapping. Clap to the extent. We enjoyed that performance, and that's why Pere will still be singing. After that, we will be taking an address, a ministerial address from the Minister of State for Health. But right about now, ladies and gentlemen, we are handing over to Pere for another mind-blowing performance. Please put your hands together for him.
Please, can we go again? Close my eyes and I can see through the dark, through the door, through where no one's been before. They can say it all sounds crazy, the mind. We can live in a world that we decide. A million dreams are keeping me away.
you so much. Enjoy the rest of the event.
And that was an outstanding performance. Do we agree? Our ministerial address. And to take that, we'd like to bring up to the stage again the Dr. Binyer opening ceremony. Can we please put our hands together as we have the ministerial address? Thank you.
A morning of very wonderful speeches, motivating us, illuminating us, and I must deliver the task that has been given to me because I must report back. So I want to crave your indulgence to still pay address by the Honorable Minister of State for Health, Dr. Isaac Adekule Salako, at this very recognized Minister of State, the Permanent Secretary for Rivers State, our host, and the young leaders of tomorrow. Distinguished ladies and gentlemen, it is an honor to address you once again today at this Sayphin conference, a platform where the energy, creativity, and aspirations applaud Sayphin for giving a voice and visibility to adolescent health and development matters. Of this conference is the evolving adolescents and youth in a digital age. Building resilient scenario has changed. Indeed, it's a changing world. And you can also agree with me that in the next few years, it's also going to be different. Nigeria, as you all know, is a country of young people because nearly half of 220 has an unprecedented opportunity to harness the demographic dividend and achieve sustainable growth, equity. We are such a that we should harness their strengths, harness their innovation, harness their energy, and you're pursuing a course that adolescents and youth represent the heartbeat of every nation. And they are not just the leaders of tomorrow, they are change makers shaping the health landscape of Nigeria. Today's adolescents navigates a fast-changing world shaped by rapid and emerging global health challenges. Very multifaceted. And harness them is now. Because if we do not, it may be a time bomb that will be waiting for us in the future. Access to quality sexual and reproductive issues, increased privilege, suffering from diseases that we know used to be for the very elderly. Socioeconomic challenges, youth unemployment, inequities, inequalities, limited access to job opportunities, inadequate education, informations, and also the need, first to mention but a few, rates. We must begin to integrate and so it's to make them to be productive Nigerians. To build resilience further, we need to expand mental health support, addressing both online and offline. That includes digital safety and consent. Encourage youth innovation in health solutions, leveraging technology for service delivery, outreach, and behavior change to have the right health outcomes. Learn and interfers unprecedented access to information and resources. It also presents challenges such as risk of misinformation that may be mentally and subsectionals. To create supportive environments that foster resilience among young people to adapt is an invaluable platform and should foster measures on how adolescents and young people can thrive in this digital age. As we work towards healthy adolescence and strong future, let us focus on several critical priority areas. Comprehensive sexual and reproductive health. Every young person deserves access to accurate information, quality services, and the ability to barriers and ensure youth-friendly service delivery. Mental health and psychosocial support. This is very critical because the mental health of our young people is as important as their physical health. We must destigmatize mental health issues, cultural appropriate mental health services for our adolescents and young people. Nutrition and non-communicable disease prevention is another key area which changes and safety of vulnerable populations is in gender-based violence. It's also very critical needs with financing. And we must leave digital health platforms, pains, offer information, scaling of innovative youth-designed digital health solutions. In this gathering, we have expertise in the room. We have researchers. We have a lot of experienced people that can help us crystallize out innovative approaches, design new programs and projects to ensure that adolescent health and young people's health and development is maximized in Nigeria. The Federal Ministry of Health and Social Welfare remains committed to adolescent health and development through multi-sectoral, through ensuring that we have a national policy on health and development as development adolescents and young people, which provides a comprehensive framework for addressing these challenges. Knowing the peculiarities of delivering services, that this population is a distinct one with unique health needs requiring specialized approaches. We must also continue to ensure policies always being there to work together with us, the civil society, the private sector. We must begin to reach out to the private sector to enlarge our partnerships and networking, sexual and reproductive health and rights, mental health support, breaking stigma and providing safe channels for care, prevention of substance abuse and violence. We must also continue to support research and data-driven policies that respond to youth realities. Esteemed participants, the conversations and commitments that emerge from this conference must not end here. They must translate into programs, in communities, in all the different stratas of governance in our country, Nigeria. It is our shared responsibility to harness the digital age, not as a threat, but as a tool for empowerment. As we look towards the future, let us envision a Nigeria where every adolescent has access to quality health services, where young people are empowered to make informed health choices, where mental health equally, and where to our young people present here today, I challenge you to be champions of health in your community, starting from self-care. What is your vision? What do you want to be tomorrow? That is where it starts. You must have a great purpose beyond in your family, or wherever you leaders of change and implement their work. And create welcoming environments where young people feel safe and respected. To policymakers and other leaders at all levels, let us ensure that adolescent and youth health remain a priority in our development agenda. As we go back to our offices, because that is why we are all here, let it not just end in this opening ceremony. Let it not just be talks, but let's work it out. Let us allocate adequate resources, create enabling environments, and support evidence-based interventions for the good health outcome of adolescents and young people in Nigeria, be it at the state level, at the community level, at the LGA level, at the federal level, even in other faith-based organizations. I commend Sayphin for their leadership in advancing adolescents and youth health in Nigeria. The society advocating for policy change and fostering professional development in the and particularly Dr. Isaac Salako, who I'm representing at this very occasion. I commend the organizers and would like them to submit the resolution of this conference. I also commend our development partners, UNICEF, UNFPA, and all the others who have shown up in this conference with passion and purpose. Let us seize this opportunity to learn from one another, inspire change, and commit ourselves to transform the health and development landscape for adolescents and youths in Nigeria. Done today. Engaging conference. And I want to end by saying, thank you for your kind attention, and God bless Nigeria.
Let's keep clapping for that ministerial speech. Thank you very much, ma'am. That was the coordinating minister for health, the opening ceremony. Can we please put our hands together one more time for her? All right, now it's time to hear from our keynote speaker, someone whose insight and experience definitely will inspire you. But before we invite her up stage to take the podium, would love to invite on stage Professor Esther Mvuladu. She is the secretary for Sayphin, and she will be reading the citation of our
Good morning, everyone. Members of the high table, kindly permit me to gently lean on the protocol that has been established so that I don't collapse it. So I'm honored to read the citation of high esteem. We've been looking forward to having you today, and I think it's a privilege. Young people, am I speaking your mind? Now, pardon me, may I request that you please stand up? For today, after now, I won't be able to do so. Thank you, ma. Please, can you? Thank you. So our keynote speaker for today, Dr. Amina Ahmed El Imam, is a distinguished Nigerian microbiologist and academic. Currently, she's an associate professor, a bachelor's and master's degree from Ahmadu Bello University, Zaria, and earned her PhD. She was a beneficiary of the Tertiary Education Trust Fund at that time. Food and industrial microbiology, And her area of focus is in food preservation, in addition to include to adding non-public publications, impair and also I don't think too many people who with the grassroots. She has also addressed a lot of public health issues with special interest on young people, focused on students in her own environment. This afternoon, we are in this country. Please join me as we welcome our keynote speaker for this year's conference, Associate Professor Amina Ahmed El Imam. Thank you.
The Honorable Coordinating Minister for Health and Social Welfare, ably represented by the Director of Family Health, my dear sister, the Honorable Minister for Youth, ably representative of Health, Professor Fatisi, a mentor of mine and President of Sayphin, part why we are here today, all of you fantastic leaders today and even greater leaders of tomorrow. Everyone here present permits me to lean gently, like my senior colleague, the professor, on the established protocol. My name is Ahmed El Imam, as you've heard, and as you can see, I'm a youth myself. I'm on this I brought here this morning. I sent in a presentation. They'll bring it up shortly. But before they do that, let me speak extempore and tomorrow. Things have changed. You are today's leaders, and certainly tomorrow's leaders. And this is the first time in the history of mankind that is very true all around the world. So believe me, if you want to lead today, you have the most important ingredient of leadership: vast and deep knowledge. Do you agree with me? You don't, because I can't hear your voices. Do you agree with me? Do you know the best part? The best part is that from the high table, they also agree with me. They are the leaders of today, agreeing that you are very much the leaders of today. So I'm going to add my voice to that of MA chairperson who spoke previously to say, if you are this knowledgeable, start determining your present and the direction. If you agree with me, a conference where we come to speak, but it will be a conference where we take action, is something you should not take for granted. I'm here to speak today about building resilient young people in a changing world. And I am privileged and honored to stand before you as the Commissioner for Health in Kwara State and Secretary of the Nigerian Health Commissioners Forum. I will be going through my speech guided by this outline. I'll start with a brief introduction, give you a few statistics and an analysis of the digital revolution's impact on youth. I'll then talk about the trend of engagement with the digital space among our adolescents and the opportunities I see in the digital. And then we move to how to build resilience in adolescents. I'll talk a little about Kwara State and the impact of EU SARA and wrap up with my call to action. This pyramid typifies our population in Nigeria. Many developing countries have this beautiful pyramid where the base is very wide and people. We have a lot of children, very young children, under the age of 4. Most of our children, most of our population is under the age of 4, at least according to the way the age groups are split. And then the higher you go in age, 10 to 14 and 15 to 19, when you add them up, you get just under
30% of the population. Oldest group of adolescents, right? That is the age where they think, I'm a cool guy. I know it all. Where the swag is at the highest level, right? Where the steez must be on point, right? 15 to 19. It is a very important part of any human being's development because many things change and it's not just the voice that is cracking. Now, if you look at our numbers, that 15 to 19 adds up to a number that is more than double the proportion in many other countries, like for instance, Japan. So that means if whatever we are doing, we should be doing a lot more for that population. If you look here, you'll see that over 60 million Nigerians are aged 10 to 19. Over 60, that is 1/4, 25%-ish of Nigerians are between the ages of 10 to 19. In Japan, the population, that proportion is less than 14%, while we have about 1/4, 25%. That means we have a very young population, a growing population. It is a blessing only if we harness it. But it is a blessing to have such a young and vibrant population, and I can see many of you here fall into that demographic. 1/3 of our population is between 10 to 24. You know, I said 1/4, 1 in 4 is under 20, 10 to 19. 1 in 3 is between 10 to 24, 10 years to 24 years. That is when you acquire your tertiary education. That is likely where you meet your spouse. That's when you get introduced to sexual relationships. That's where you will acquire all the skills that will determine the rest of your life. It is a very crucial part of one's development. I'm glad I don't have too many statistics because the head of GASHE, my own brother who gave a speech earlier from the Federal Ministry of Health, gave us fantastic statistics. But it's crucial for us to note positive news here. Our fertility since 2008 to the last NDHS in 2024 has been declining. We have about 77 adolescents per 1,000, are having children. The ideal thing is to have much lower than this because fertility, reproduction is not a very easy thing for women. And when you have it, and this demographic, your demographic, contributes some of the saddest stories that we've experienced on the field, and a huge proportion, a disproportionate number to the maternal mortality challenges that we have in Nigeria. Additionally, as an adolescent, you're not really, in most cases, you're not an adult. If you're 15, 16, you're not considered an adult mentally or for legal reasons, you're not an adult. So technically, it's like having a child, raising a child. And that can result also in infant mortality. So this fertility figures of 77 per 1,000 is something that we hope will reduce with more interaction and education. It ends in stillbirths, in some it ends as live births, and in some it is unfortunately removed, but they've had one pregnancy at the minimum. Many of you were born, what is this button? So you are the privileged. So vast amounts of information. For the first time in the history of humanity, any human being can learn anything. I'm in the business of education. As you heard, I'm an associate professor myself, and I'm in the business of knowledge. So do you know how mind-boggling it is? You don't. You don't know. Because none of you here had to take 2 cabs to go to a library to dust through a 50-year-old textbook. Did you? Exactly. They have no idea, sir. My prof knows what I'm talking about. They will give us assignments then. We will go to library and go and book 2 weeks in advance because somebody just booked that book 1 hour before you got to the library. And that book, that narrow perspective that the book presents is all you have to work with. You go to reference area, you go to encyclopedia that are this big, you have to carry the book, hug it to your tummy and walk to a table, hide yourself and flip through till the sun comes down to write one. Emphasizing this is because you don't know how lucky you are. I went to ABU Zaria. Our library is called Kashim Ibrahim Library. So they call some of us killers. Not because we killed anyone, but because we tried to do well. You had to be. To dig deep for days and weeks on end to get all the information that might not even be representative of the entire spectrum of knowledge around that topic. I think they should know. Want to do this dilution, talking about solutions and so on. So I said dilute a one normal solution to 0.1 normal solution, and several days later he came back and went, I don't know how to do it. I scratched my head and went, really? In 2022? Really? What about Google? He was like, It was like an epiphany. I went, did you Google it? He said, I didn't think about that. I'll go and try. And I went, you don't know how lucky you are that everything is a quick search away from you. So I'm using this opportunity to emphasize that anything in the world, anything at all that has happened before your time, since the beginning of recorded history that you want to know about, is available if you know how to use it. Knowledge is money. Knowledge is attitude. The vast information access. Those who knows everything. All about you. All about you. With a silver spoon, how much time I have for Instagram? You have missed 2 prayers when I started browsing. Because it is designed by some of the most brilliant people in the world, and the sole aim is to keep you glued to your phone. You don't stand a chance. You don't stand a chance. The game is rigged against you the moment you downloaded that app. You are, you know, David and Goliath. You are David. You are an infantile David against the steroid-jacked Goliath when it comes to social media. Do you know how much Mark Zuckerberg is hiring AI experts now? Hundreds of more money than the people building manufacturing. That's all. To make you glued to your phone. So you can set a timer so that you do not get addicted. And all the things you are watching on TikTok are designed to keep you glued. Quick fix of dopamine. Is there any video on TikTok that is 5 minutes, 30 seconds, 1 minute, 30 seconds, 1 minute? You are laughing, you are going, oh, you are crying, you are laughing. You have to recognize them, but there are opportunities. Everything you're watching was created by someone, am I right? You can create the same thing. Be a creator more than you are a consumer, so that you can use it as a source of income generation. You can use it to communicate. We mothers are complaining that you spend 12 hours a day on your phone, but you don't call us. Mothers, am I alone here? Am I alone, ma? You see, you are here. You're also attesting that you don't call mommy and daddy. You spend so much time playing along with, crucial for your mental health, to strengthen familial ties. Now, our worlds are in the social media. Our worlds are in our phones. This is where you are popular. This is where you are making money. This is where you are studying. If you're not careful, you will forget that the sun even shines. You will forget what it feels like to literally touch grass and feel grass beneath your feet. That's why we need to ensure that we do not threat, I have noticed, with the digital age, is exposure to misinformation. We all heard of the challenges going on, not challenges, the changes going on with the new government, right, in America. Religious crime. There is no middle ground anymore. Nobody say exactly what we want to hear and to lead tomorrow. You have to learn kids actively. So we also know about fake news and how it is going around in the world. You have to be careful. That is where I didn't hear you. Question everything. Whatever you read, question it. Again, next slide. Thank you. In smartphone and internet adoption rates amongst your generation, that's the youth. Like I've said, it can be a very good thing. Start to wonder, is poverty a choice? There's almost nothing in the world you cannot buy or sell on the station or something. Do you know the doors that all your sets don't have a tool to do any and every digital space? Whatever you do as a child, your neighbors platforms, as I mentioned earlier, and by getting something back, and by getting something back, exclusivity, more you're using social media, more you're using social media, excessive. Basically, I've mentioned the United Kingdom physically, to online PhD from the alumnus or alumna of that institution abroad. Certificate as you are willing to learn is civic engagement. I mentioned earlier, you are the greatest advocates for your own needs, not us. And when we were adolescents, our realities were different than yours. So use social media to carry out civic engagement for what you would like to see. I wish there were more youth in this hall today, because something tells me if Davido came here now, if Davido had come in here today and gone, what is one popular Davido song? Fire, fire, fire. The hall would be full, and people will be hanging on the roofs. But those are temporary pleasures, entertainment. The things that will change your lives are the conversations that we are having here today. So let's use the digital revolution to better opportunities. Do you know that before now, to be called a CEO, you had to look a certain way? You would be like 40, 50, you would have a little pouch over here, some balding and graying, and you say, I'm the CEO of something. That is what it was like 30 years ago. And then came the Mark Zuckerbergs of this world. Then came the Iyaboye G's to be an innovator and a leader. And I want to see more of that. More youth doing the impossible with the available, because everything just became possible. Entrepreneurship has soared. If you're a Nigerian woman, first clap for yourself for nothing. Just clap. Thank you. Nigerian women are one of the largest groups of entrepreneurs in the world. The Nigerian female entrepreneurs is the largest of any, women demographic in the world. We are traders at heart, we are entrepreneurs at heart. So we want to see more younger people in it, because by the time you are 50, you should be able to say, oh, I have 30 years of experience in this. Because what we have at the moment is people with the experience are too elderly to make the change and do the footwork. People with the energy are too inexperienced to do what it takes to shake the system up. So if you start early, you have the best of both advantages. What are the risks that you face in the digital space? You've heard about cyberbullying. You've heard about fraud. Many youth spend so much time. I know how many students' school fees I had to pay as a lecturer because they put their school fees in crypto. They put their school fees in MMM and the likes, Ponzi schemes. We, the lecturers, from our meager salaries that don't even get paid sometimes, emoluments that never come, EAA and the likes. Prof, you know what I'm saying? We will raise school fees to pay because some adolescents got trapped in fraud online. Please eschew that. And I want to see more advocacy sensitizing your age group towards avoiding this. There's also cyberbullying. Because you spend more time online now, that doesn't mean you have escaped the bad people. The bad people are online too. Those kids that have issues that they've not resolved and are looking for people to vent on are on the internet bullying you for merely existing. That's where they get their own wins from. Cyberbullying is very real, and a number of people have even committed suicide because they were victims of cyberbullying. So these are the risks. Misinformation exists online. Overload and of too much information that you might even forget the first few things you read because you read so many things afterwards, or you might have so much information you don't even know what to do with it, or you might get discouraged from opening the internet or browsing because there's too much. Very crucial one, mental health issues. You get stressed out when you are online making comparisons. Oh, I just made locks.
1 year ago. How come my own locks are not at waist length and this creator's locks are at waist length after 3 months? It's that ridiculous. But it's very real. These are legitimate questions that people ask online. They begin to stress, they begin to get anxious, they get a tape rule measuring their locks, and before you know it, it's a vicious cycle. You get more stressed. Because you're online, you see young people doing so well, you begin to get depressed, going, how come I'm 21? How come I'm 19? How come I'm 18 and I'm not as rich as XYZ? How come I've been on YouTube as a creator for 2 years and I do not have half the followers of Mr. Beast? So, this slide is to tell you mental health. And this information should not be tied to the social media and the digital space. And this applies to all of us, including online. We all know that pedophiles who are looking for young girls to have intercourse with. But it can be flipped. It could be adult women and young boys too. So, having your children under maybe 18 online significantly exposes them to that risk. Exposure to harmful content. I have heard that more than half of the information online by memory space is pornography. More than half of what is online in terms of space utilization is pornography, which is not something we want children or adolescents to be exposed to. The digital divide is real. There are disparities in access. I think this is both a blessing and a curse. A blessing in the sense that you can get access, but it's a curse in also the way the disparity is they will be shortchanged, they will be negatively impacted. But because of some of the downsides, sometimes it's a blessing when young people do not have access to the internet, particularly those who have potential addictive tendencies, particularly those who do not know how to manage it or who do not have guidance to utilize the space properly. If you look at the intake, and if you are consistently taking in negative information, you end up becoming that. Body to adapt to change, to no matter what life throws at you, to be able to fall down 9 times and pick yourself up 10 times, to be able to look at negative situations and still find the silver lining and make the best of it. So the capacity of adolescents to adapt positively to adversity and change is called, resilience. I want to mention a few key elements to building resilience in adolescents. Firstly, we must have supportive families. Everything starts from the family. So if you are a parent who has not sat your kid down and said to them, I love you, you are important to me, my life is a better place because you are in it. I'm a better person because I get the honor to be your parent. Your child, if it all gets too much. Additionally, your values must be inculcated into your child at home. So that as a state, the Kwara state government is keen on increasing the number of youth-friendly spaces and youth-friendly and spaces and health services that are available. And I would like to implore River State through the Permanent Secretary and the Federal Ministry of Health through my coordinating minister that we prioritize creating youth-friendly spaces. Because youth are too cool to be children, but they are not wise enough to be fully adults. They can't navigate the health system as confidently as an adult would. We sometimes call the youth the forgotten middle because we are not targeting them with immunizations anymore. We are not targeting them with what we target 0 to 5 or 0 to 7-year-old children with anymore, but they are not yet fully adults in many cases. I want to mention also that another key element is digital media literacy and their responsible use. You have to learn on your own how to use the social media and the digital tools responsibly. You have to learn. You have to use the digital tools to learn how to use the digital tools responsibly. So you have to make a conscious effort to look for that. You have to also build some mental strength. You see, we can't keep saying, oh, this person did not like my, to bounce off your skin like water off a duck's back. Don't take everything too personally. The fact that your boyfriend liked a woman's post is not immediate cause for breakup or divorce. as I'm starting to hear now, we need to be more mentally tough, take things in stride, and not let things get to us too easily. There are ways to do that, but we have to start the journey. We have to also train the peer educators in our youth-friendly spaces and our primary healthcare centers, even in our post-primary healthcare centers, on adolescent health. A key way to build resilience is also to develop emotional intelligence. You have to learn to speak with confidence, learn to sift information, learn that because you saw somebody talk to their mother, hey mom, what's wrong with you? Does not mean you bring that home. Before I speak for other mothers, but if you have a Yoruba mother, are you with me? Okay, you recognize what I'm saying, right? So you have to learn to be emotionally intelligent. You have to learn life skills. If you are a young person, the more time you spend online, the less time you have practicing social person-to-person engagements. So you see a young man, 19, 20, approach a young lady and goes, what's up? That's all. The battery has died. No communication skills, nothing. No interpersonal relationship skills, nothing. They just sit there pressing their phones together. They can chat in that text speak on WhatsApp, but that's it. Physical interaction becomes almost zero. It is so bad. I had a student come to meet me to help him talk to me and said, the lady is one of my project students and he knows that she sees me as her mother. Please, I should tell her that he likes her. Are you for real? Me? Are you? Hey, I've suffered as a lecturer, Sha. That was my response. He had the best intentions. He couldn't communicate. And it's an epidemic. We have inarticulate young men, inarticulate young women. So these are life skills that will help you a long way. Because if you are in the businesses, if Dangote walks in now, do you know how to chat him up between the door and the stage? 45 seconds to pitch to Dangote. Do you know what to say? While you are doing, licking your lips and rubbing your fingers and feeling cool, he has come to the high stage. Do you know what to say in 45 seconds? These are life skills we should all build. My next slide will talk about what Kwara State is doing about building adolescent and youth resilience. Again, I apologize that my slide titles are not showing on the screen. I don't know why. We are advancing adolescent health through an inclusive policy, inclusive infrastructure, and inclusive service delivery. In Kwara State, recently we just opened 2 new adolescent centers, one of which we invited the European Union and the UNICEF and UNFPA and the Federal Ministry of Health to visit. This is a crucial thing because, like I mentioned, youth want a space where they feel welcome, where they can indulge in their fun activities, their sports, and so on. We are also collaborating with the Ministry of Women Affairs in Kwara State. We work hand in hand because we know that youth issues are not 100% health issues. There is an overlap, so we need to partner with our fellow MDAs to deliver a holistic youth service to Kwara State youth. We're also working with the Ministry of Tertiary Education. We want to take some health promotion activities to tertiary institutions, and we cannot do that alone. We are giving health talks in tertiary institutions. A lot of our support for that's PA provide us with fantastic support in executing that. For us is that, and even provided with commodities that is already with sexual activities safe. I am lucky and privileged to come from Kwara, the state of Malam Abdurrahman Abdurrazak, the executive governor, who is also the chairman of the Nigerian Governors Forum. You've heard of he for she, right? You've heard of he for she. My governor is the living embodiment of he for she. The former minister, thank you. The former Minister for Women Affairs, Pauline Talent, came to Kwara, decorated him. He's been decorated on multiple stages, including by the United Nations, as the governor who doesn't talk, just does the work. Women are given priority in Kwara, or I wouldn't be standing here before you today. He was the only state ever in the history of Nigeria to have 50% cabinet representation for women. 50% of the commissioners in Kwara are women. And they didn't just put us in just any position. They put us where they thought we could make a difference, and His Excellency gave us the support. Do you also know that the youngest female lawmaker in Nigeria comes from Kwara State? Honorable Rukayat. She's a House of Assembly member representing Asa, Odeoniri district in Asa. Do you also know that the youngest commissioner in Nigeria is in Kwara State? She's in her 20s, the Commissioner for Environment, also a woman. So not only are women doing well, the youth are doing well in Kwara State. So it's no surprise that women's and youth health are a priority in the state. When you get opportunities, you don't burn the bridges so that nobody else comes there. That's old school thinking. When you scale through, you see that ladder you climbed, you fortify it every step of the way. You hammer more nails to make it more sturdy so that more people can come behind you. So for every one of you here today who is privileged to have been in this conference, to have learned from fantastic advocates of youth health like Prof and everyone on this stage, please go out and spread the word of whatever you've learned so that we have a more educated youth demographic and so that the country can be the better for it. I was talking to you about our youth spaces. Before youth spaces, I think I have here graphics showing that we have over 100 health providers that we've trained. We have mobile outreach programs that we do for the youth, and then we have more adolescents visiting our youth facilities now. And this is one of the youth facilities. This is the country rep of the European Union, Dr. Ayeke, when he came to Kwara State for the national meeting of the EU SARA program. And as you can see, he's pointing at the adolescent wing that we have in the Kwara State University Teaching Hospital. And this is in Kwara State. Mr. Buhari, stand up. That woman is fantastic. She's the Speaker of the Children's Parliament, Fauzia Alaya. Please stand up. See them. Words with action. If you were once or are currently an adolescent, I'm speaking to you. We need to recognize that while we may have crossed the initially, so that they pass through a better speaking, and he's trying to be, give me the money. He's just, and he goes, come on, have a pimple, a solid foundation for them to make it less difficult for them mentally and physically. Call to action. It's tough enough with, can take a toll. Nigerian adolescents, they're not listening to me. Adolescents, I want you to advocate for more youth-friendly services. We, the Commissioners for Health, are committed, and I say this without equivocation. The Nigerian Health Commissioners Forum is committed to ensuring solid adolescent services for all our adolescents in Nigeria across the 37 subnationals. Thank you. But you need to remind us, you need to push us. We have one fire or the other to quench at any given time. It is very easy for adolescent issues to slip through the cracks. Keep the pressure on us, and we will deliver because our hearts are already in it. So we are pledging that we will do more youth-friendly counseling services in Kwara State to support the mental health of adolescents, but we will also need to partner with schools and the tertiary education or education ministries for more school mental health programs. Across board, if you are a parent, if you are a proprietor of an institution, if you are a policymaker, regardless of what you are, ensure that we have more life skills instilled in our youth. We want more articulate, more competent, more intelligent, more eloquent, more attractive, more logical adults. And the time to train them is now that they are adolescents. If you are unable to make informed decisions, if you are unable to critically analyze and not prepared for the stress as something that is earth-shattering. It's natural. It's the way of the world. We want youth to become able to manage peer pressure better. So this is a support. We need more training for parents on how to help youth navigate the digital age, and we need to strengthen mentorship programs. Youth need positive outlets. An idle hand is the Thank you. An idle hand is the devil's workshop. If you are idle, that's when you think about the worst possible things to get involved in. If you have a tall ball in it tomorrow, youth and these rings, they don't joke. They will throw a ball in it. He'll pick up basketball. It keeps them occupied. It gives them an outlet. The arts. Get your children involved in the arts. The gentleman who sang for us, if you are in this hall and you didn't have goosebumps, let me see your hand. Exactly. Everyone enjoyed his singing. Did we? That's the arts. Or get them to volunteer. Just returned from the United Kingdom. And my kids would go, Mom, this is Nigeria. Nobody does it. And I said, you just do your own. And before you knew it, another of our neighbors began to join us. And we began to work together, to keep the streets clean for some time before we paid people to do it. Digital literacy. Again, we've talked about safe social media use and the ability to question everything. The digital space. In here today, if you've all time, because you're transitioning from childhood to adulthood, it has been made even more difficult because now you have challenges your parents' intentions that our generation has. I want to appeal to you to teach us to teach you. Teach us to guide you. Learn what is right on your own. On your own. Tell others to set a timer for social media use. Tell others to stop being consumers. You don't all have to become comedians. There are many things you can create. You can start teaching online. Do you know, as a tailor, you specialized information that can help you become a leader, a thought leader in that space. Whatever you do, please remember that everything is a double-edged sword. We use the digital space to become a blessing for us. And it is on this note that I want to thank you for listening. And my cool guy here is thanking you specially. Thank you very much.
Ladies and gentlemen, put your hands together for our keynote speaker. Please clap to the extent at which you were inspired. I told you with her years of experience and insight, it will be an amazing time. And I'm sure you witnessed and experienced that. Can we please one more time put our hands together for our keynote speaker? That was truly inspiring and insightful. Before we move on, would love to invite the photographer. Please come forward. We'll love to take some pictures. Sersmas, can you kindly come forward? Thank you, DJ. The order of photograph, as soon as the high table members are done taking theirs, would love to invite our special guest. Everyone in the front row will please that you come forward after this. Okay. Ladies and gentlemen, while the keynote was ongoing, we had some distinguished persons walk in and would love to recognize them. The Executive Secretary, Rivers State Primary Healthcare Management Board, in person of Dr. Chituru Adele. Please put your hands together. They're represented by the Executive Assistant to the ES, Dr. Justice Ohaka. Please put your hands together for him. Thank you very much. Also, we have the presence of Professor D.K. Aliko, the Chief Medical Director of Rivers State University Teaching Hospital, is here in our midst. Kindly put your hands together for him. We're not clapping. I know they are taking photographs. DJ. Ladies and gentlemen, while the photograph is going on, kindly note that up next will be presentation of awards to the speaking competition winners as well as the theme song competition winners. We will be presenting an award to them. We make the presentation of awards to our speakers, the speaker competition winner and the theme song competition winner. We would love to decorate our keynote speaker and present an award to her. Carrying us on for that particular item will be the Professor Adeshegun Fatosi, who is the president for Sayphin. Can we please put our hands together for him as he comes up stage?
All right, ladies and gentlemen, I am sure we have had the most stimulating lecture. That was a combination of a commissionerish experience, plus lecturership experience, and parentship experience, and details were all rolled together into one. What an amazing time we had. Thank you so much, man. Please, may I invite you to just please rise as I'm sure you will agree with me that if we designate her here and now as Sayphin ambassador, nobody would disagree. And one of the power of being a president is that you can decree. And particularly when you are not just a president, you also hold the mic. That's a double power. So let me invite Professor Adeshola, the president-elect of our association, and the Vice President of International Association for Adolescent Health for Sub-Saharan Africa to please decorate her with the Sayphin materials.
So on behalf of the Society for Adolescent and Young People's Health in Nigeria, it's a huge and a tremendous pleasure and privilege to be able to decorate you as an ambassador for Sayphin, lifetime ambassador, man. Thank you.
Ladies and gentlemen, let's keep the applause going.
And on behalf of all of us, particularly the young people in this room, who you have blessed so much with so much knowledge, I'm honestly persuaded that if the young people in this hall will use the knowledge you have given them, they can truly transform their environment and transform their environment and transform the world. So, on behalf of all of us, it's my pleasure to present this to you as the keynote speaker for Garden City 2025. Thank you very much. Can you put our hands together for one more time? It is not every program you invite the minister to that will come or send somebody. And I know that the minister truly will have loved to be here. I know that. And I know that he has not just tried to send anybody, he has tried to send to us somebody who is so powerfully interested in adolescent health. The last time we were together in Nasarawa, the director came in and said, I decided I'm going to come for just one day. And I said, when are you leaving? I said, no, I'm here all day. And she was with us all day as Tenka working group. And I just said, thank you very much, ma. We are glad that you are the one representing the minister. I hope you become a minister so I can invite you your own right. On behalf of every one of us, we'd like to present this to Dr. Isaac Adekunle-Salako, ably represented here today for his passion for young people and for the great work that is collaborating with the coordinator for the coordinating minister to do for young people and for our health system. Comrade Ayodele Olawande is our minister for health and is truly useful at that. Go to the Ministry of Youth website. You see something where you are running a program, you can go and put detail. I went there a couple of weeks back and I was amazed at what is happening on that website. And he has sent representative not only one, yesterday was represented by the special technical advisor. Is that title? I can still see him sitting down. Yesterday was in black, today is in white. Tomorrow will be between black and white. Maybe that will be green national color. It's good to have you here, sir. Let me invite our brother and friend, Alaji Kabri, who is there representing Minister this day, to please accept this award on his behalf. Thank you so much, sir, for not only representing, we know what you have been doing in terms of youth policy over the years. We are glad and we are so encouraged that you are here today to represent the minister. Thank you.
Thank you so much, Professor Adeshegun Faculty, and congratulations to the awardees. We'll move on quickly to the next category that we have, and that would be for the Sayphin Speaker Challenge. And to do that, I would like to bring off stage again, Eve would put our hands together for the chairperson of this occasion. Let us welcome Dr. Binyere once again for the presentation of our award. Please let's put our hands together as she comes forward for the presentation for this category. And for the Sayphin Speaker Challenge winners, I would start with the third place. So for the third place, we have Uzoma Dike Febechi, the third place. Can we please put our hands together for the third place? Thank you. Would have the second place. The first place, please get ready, as well as the theme song winners, get ready. So for the second place, we have Joel Gideon Olawale. Can we put our hands together for the second place for the Sayphin Speaker Challenge? Yes, to the first place. Can we put our hands together for the first place? Let's welcome Favor Uno once again, the first place for the Sayphin Speaker Challenge. Thank you. And yes, moving on quickly with the team song competition winners, we have the second place, and that is Just Upright. Just Upright is the second place for the team song competition. Are you here? Okay. Okay, we'll move on to the, is there any representative? Oh, okay, we'll move on to the first place. So for the first place winner for the team song competition, we have Tarzan Wung. I beg your pardon if I don't call this correctly. Freeman Trevor, yes. AKA Ziggy. We saw the performance earlier. Give it up for him, everyone. Congratulations and welcome once again.
So we all know that the internet space can be addictive, especially when exposed to things that are explicit, peer pressure, and sometimes depression. Fit to make a man sit down, start to reason, but as youths, it goes deeper than that. There's a lot you can achieve, and we all know the fact. It depends on what you want and what's in your mind. It's a weapon, and we all got to use and right. Cause on here, there's unlimited access to information, and it gives everybody a sense of expression.
So ladies and gentlemen, we have a special award presentation. This is a secret. Absolutely nobody knows about this, but you are going to see who is receiving this award right now. To make the presentation of this very special award, would love to invite Professor Adesola Olumide. Can we please put our hands together for her as she comes up? Professor Adesola Olumide.
Well, standing or leaning on the existing protocol again, it's a pleasure to be here with us. So usually we have a culture of giving a surprise award to someone in the audience, someone who has been passionate and someone who has been with us throughout the adolescent health and Sayphin journey. All right. And so, sorry. I apologize for this. This is network going in different directions. So I'd like to ask our current president, Professor Adeshagun Fatusi, to please stand up. We have handkerchiefs available. We have at least 2 handkerchiefs available. And to tell you, sir, that as you graciously step aside, not yet, you still have 2 days. After your tenure of extraordinary service, we celebrate a legacy defined by vision, passion, and purpose. You have not just led Sayphin, you birthed a movement, you charted a bold course, and you have inspired generations to rise for adolescents and youth health and development. Through your unwavering commitment, wisdom, and compassion, you have built foundations that will support countless futures. Though your tenure as president is about to conclude, your impact echoes far beyond titles and terms. You remain always the heart of this mission. You are a beacon of excellence, and you are a model of selfless leadership. Thank you, sir, for planting the seeds, for nurturing the growth, and for guiding us with a steady hand. With profound respect and admiration, we honor you. Your legacy lives on. The Sayphin family with love and appreciation.
Can we invite Professor Mrs. Fatusi up on stage? And can we invite all the members of the Sayphin executive and members of the core Sayphin LOC to come up and take a picture with our Oga? Can somebody help me usher Professor Mrs. Fatusi? Bring her forward. Please come. We'll take this picture without you. All the photography. Come this way. Let's come to this. LOC, I'm waiting for you.
Pata pata, kufuge kilomita me number, so yellow senorita, you give me some magic. Don't wish you don't pay me, and you give me some magic. I put in your girl, like you know I'm not.
Members of the high table join in the photograph, please. Thank you very much. We also love to have our special guests join in the photograph. Thank you very much. If you're a member of Sayphin, kindly join in the photograph. Either you're, as well as the LOC, if you're a member, kindly join in the photograph.
Olalade Miyashake.
Our partners and sponsors welcome you to join in the photograph as well if you are not here already.
Angeli, come and lay me.
Every member of Sayphin,
to back me, consider lucky.
come forward please and be a part of the
My
photograph.
baby, let's keep on jamming. This fire cannot cool down if you dare me to snore me. Hey! Shalom, my baby.
Thank you very much. Distinguished guests, ladies and gentlemen. Thank you for participating.
Big money. My guys, confess size.
Ladies and gentlemen, we are coming to the closing of our opening session. And for her closing remark, kindly make welcome with a resounding applause the LOC chairperson for Garden City 2025 Sayphin Conference in person of Professor Omosive Maduka. Ladies and gentlemen, please put your hands together as she takes stage for her closing remark.
Wow. It's been quite a day. What do you say when all that you have dreamed about happens before your eyes? What do you say when the vision planted in your heart and in your mind by one man, Professor Adeshegu Fatusi, is coming to life? What do you say when the gathering of champions includes the young youth, the older youth, the academic youth, the international partner youth, the local partner youth, the NGO youth, the state government youth, and the federal government youth, and everybody in this auditorium that is a youth? What do you say when the space of champions includes phenomenal people like you, co-creating a better place and space for the Nigerian youth today and tomorrow? You say, thank you, Lord. You say, thank you, Sayphin. Thank you. You say to your LOC Dream Team, are you in the house? You say, thank you. This program will not be a reality without you. You say to your partners, to your sponsors, and to your supporters, Girl Effect, UNFPA, UNICEF, AHEAD, Federal Ministry of Health, Federal Ministry of Youth Development, FP 2030, M1, Renaissance, MHR, the Lancet Commission on Adolescent Health and Well-being. You say to Sparkle, to SFH, to SWAG, to UNESCO, to PATA. You say to EVA. You say to WBFA. You say to the River State University, the River State Ministry of Health, the River State University Teaching Hospital. You say to ACE Puto. you say to EGPAF, and you say to the Challenge Initiative and the School of Public Health, from the depth of our hearts, we thank you. As we go on into the rest of the conference, please let us understand that the initiative and the imperatives that we have learned this morning at the keynote speech and every other part of the conference, the ministerial address, let us take it into every session with rapt attention. Let us pay our seriousness to the issues at hand. For because with you and with I working together, we can indeed change the landscape of young persons and adolescents in this country. Let us go into the rest of the session with zeal, with vigor, with enthusiasm, and with steeze. Thank you very much, and God bless you.
Thank you so much, the LOC chairperson. Everybody in the room would agree that she has been working with so much steeze. Do we agree? Thank you. So we'll move on quickly to our vote of thanks, and we are going to be closing shortly. But online participants, we see you and we acknowledge you. Thank you for being part of this. So to take the vote of thanks quickly, we're going to have upstage the Secretary General of Sayphin, and that is Professor Esther Mboladu. Please can we put our hands together as we welcome Professor Esther, the Secretary General of Sayphin, for the vote of thanks. Please keep clapping until she is here. Thank you.
Wow. My job is supposed to be very easy, but where do I start from? It's been so amazing. I think we didn't even notice the time had gone because we've all been engaged and we've all been glued to all the speeches, the discussions that went on and all that. But I would like to begin my appreciation in the reverse order. I want to thank the adolescents and young people that are here. Are you here? Are you alive? Are you active? Are your senses all up there? Antennas are up there. Thank you for making this event happen. It's because of you that we're all here. Sayphin is excited to have you. Thank you for coming. And I would like to say a very big thank you again, and to let you know how important you are to be able to bring in this caliber of people to this opening ceremony or even this conference. You are highly, highly appreciated. I think we all saw that. Thank you. I won't want to take all our time, but honestly, I would have just said thank you and then just go back to my seat. But I will begin with our partners. You've been so amazing. Our platinum partners, some of you surprised us, but we're grateful. UNFPA, I don't know what to say. Yesterday, my president, still our president, was, he said he's not sure whether it is UNFPA or UNICEF who owns us, but honestly, you are all amazing. You made this thing happen. You made the conference happen. Thank you for being our dependable partners. Thank you, Girl Effect. You surprised us. We're grateful. Thank you. Thank you. And for all that you're doing for the young people and for being here. All the wonderful talk was amazing. I also want to thank other partners. They were not platinum partners, but they are also very important partners. All that you did for this, we recognize it. UNESCO is here. There are many others. You can see them, all their logos there. Pardon me if I don't call all the names, but Sayphin is truly great for our federal government, the minister himself. And amazingly, not just one minister. The Minister of Health or representatives, honestly, this is amazing. Thank you. And I'm super excited that it is the Director of Family Health herself. She has really shown tremendous interest, particularly for adolescents and young people. I remember we met in the TWG, and she stayed all through, and she kept looking for little details. She's looking for how to actually change the narrative of what is going on with our adolescents and young people. So she's looking for the solution, and however, she's still doing it. Thank you for being here. Thank you for your support. The director of Gashe, you know, he's always with us. Sometimes I'm tempted to say you're just part of Sayphin, but you know you still have to be government. So thank you for being our advocate. You know, we trouble him a lot when we want to talk about adolescents and young people. Thank you for being there. The other people that came around were grateful. I want to also thank River State government, the sole administrator, the vice chancellors, the medical directors. We have so many of them. M1 River State, you've all been so amazing. We have enjoyed tremendous support and we're grateful. I hope I'm not leaving out anyone, but if I have, it's just because of the time. They didn't give me enough time. So I won't be able to list out everyone. But thank you all put together that we're trying to change the narrative. Our keynote speaker, I want to particularly thank you because you did justice to this topic. And she has educated us about the positivity of the digital space. And also, she didn't just leave us like that, but she told us also some of the drawbacks, you know, and she left us with actionable points. We're very grateful. I am more than excited that you are our Sayphin ambassador. Thank you for accepting it. At the spur of the moment, you did, and she's also a young person. Do you agree with me? Yes, she is a young person. And of course, all the people seated here are young people at heart. For me, I am just 16. Whether you accept it or not, I am 16. Don't I look like? Thank you very much. We're grateful. You know, the LOC, amazing team. Amazing. You know, the next conference is coming up in Jos, and I'm already trembling because they've raised the bar so high, but we'll try to catch up. Thank you, LOC, chaired by no one else but Professor Omosove Maduka. Very energetic, very brilliant, very talented. You know, just say it and she presses the button. There are so many of them who supported her. Of course, you can agree that it didn't happen with just one person. So the entire LOC, we are grateful to you. Sayphin 2025. Can I hear that again? Sayphin 2025. So thank you, thank you, thank you, and thank you very much indeed.
Can we hear a round of applause for her? As we come to the close of this session, I would love to call up stage Dr. Chigozirim Ogubike, the LOC Secretary for... Ladies and gentlemen, please put your hands together for the LOC Secretary, Chigozirim Ogubike.
Okay, we can all agree we've had an amazing time. I want to stand on the existing protocol and want to make some announcements. It has been a learning point. I've learned a lot. The keynote speaker actually did justice to the topic, and I was actually writing with my notepad and my phone. So, okay, the first announcement we want to make is Tea-Bake is actually ready. I know the time is past pence, it's almost past 2. Well, I call it brunch. Brunch is ready, tea-break is ready. And for our VIPs and our dignitaries that are going to be in the green room, this VIP lodge, that's where all our dignitaries, our special guests, they will go and take their lunch at this green room. Then all persons with disability, LOC volunteers and support staff, they will all go to the dining hall, far right of the foyer. That's where you get your tea break. Then all other delegates will be served in the dining hall on the first floor. Please, we are pleading, our time is actually fast spent, so we just have 15 to 20 minutes to actually get our tea break and come back for our plenary sessions. So we are going to start in the next 15 minutes. Maybe at 2:40, we all converge to the hall so we can start our plenary sessions. So we encourage us to have our tea break. Also, we have counseling booths. The last booth are the exhibition booths. So we encourage our young persons to go there. We have seasoned counselors that will actually attend to us. Also, we have the game centers. Some of our young people haven't been coming to our game centers. Please go to the game centers at the back of the secretariat. Go to the game centers and actually enjoy yourself. It's actually a relaxing time to go and have fun. Also, let's also visit our partner booths. They have a lot of materials. They have a lot of gift items to give to us all. So this is the last announcement. I know we had an amazing time. We'll see you later by 2:40. Thank you.
Thank you so much, and thank you for being part of this event. We would now rise for the national anthem as we bring this to a close.
Nigeria, we hail thee, our own dear native land. Though tribe and tongue may differ, in brotherhood we stand. Nigerians all and proud to serve our sovereign motherland. Our flag shall be a symbol that truth and justice reign. In peace or battle honored, and this we count as gain. To hang on to our children a banner without stain. Oh God of all creation, grant this our one request. Help us to build our nation where no man is oppressed. And so with peace and plenty, Nigeria may be blessed.
Please put your hands together for yourselves, ladies and gentlemen. With that, we have come to the close of the opening ceremony for Sayphin 2025 conference, 4th Nigerian Conference on Adolescents and Youth Health and Development. Would love to have a photo session, please. Can we get our special guests and our partners upstage to join in dignitaries?
All right, go.
And also note that we have something out there for you. Take the time to stretch, have tea, if you do have tea, by noon, and relax with our games. Don't forget to visit our partner booths all out there. We're here for you to have a good time and an amazing time.
Dan jan samu kuɗi ko da sata ne.
Fita min daga cikin gidan nan. Ina kokarin da ba ta kowa ba ko da ni gidan ku. Yau ya yunkurin taɓa min nuna.
Ita ne Yakubu ya je mata ciki.
Kai! Kula ne ku. Sani!
Kai dai ka kula da abokanku masu yi wa mata ciki.
Kai?
Me tsakaninki da wannan mugun mutumin?
Me yasa tuntuni ɗan Ladi baka sanar da ni wannan abun ba har sai da abin ya kai wannan?
Mahaifina zai kashe ni.
Bari mu sake komawa gidan Malam Musa.
Ta ya zai zama laifina?
Ladies and gentlemen, kindly note that we'll be back here in 20 minutes by 2:40 to resume our plenary sessions.
Yau din nan akwai matsaloli da yawa.
Ba wanda ya san wannan labarin.
Shaye-shaye yana nufin amfani da wani abu wanda zai gusarwa mutum da hankali ko ya sa shi maye. Shaye-shaye abu ne wanda ya zama ruwan dare a rayuwarmu na yau. Shaye-shaye abu ne wanda bai tsaya akan matasa kaɗai ba. Wasu tsofi ma suna yi. Haka kuma abin bai tsaya akan maza ba, har mata suna yi. Wasu daga cikin abubuwan da ake shaye-shaye da su sun haɗa da wiwi, ƙwaya, angur, giya da sauransu. Abubuwan da ke jawo matasa su faɗa harkar shaye-shaye sun haɗa da ma'amala da abokan banza, rashin sa ido ko sakacin iyaye, rashin ilimi ko da rashin tunani. Da wasu daga cikin ɗabi'un masu shaye-shaye: yawan faɗa, yawan zagi, yawan fushi, wasu ma har dukan matansu suke yi. Wasu daga cikin illolin da shaye-shaye ke sawa sun haɗa da matsalar ƙwaƙwalwa, ciwon huhu, rinewar fata da dai sauransu. Hanyoyin kare matasa daga shiga shaye-shaye sun haɗa da yi musu addu'a, ba su tarbiyya, sa musu ido da kuma lura da waɗanda suke tarayya da su. Haka kuma za a iya hana shaye-shaye ta hanyar hukunta masu yi don ya zama izina wa 'yan baya.
Da sunan Allah mai rahama mai jin kai, Allah ya sa su gane.
Iyayenmu mata ba su sauraron mu, sai dai Allah ya sa su gane.
Dama za mu samu ba mu da wata matsala ta kanmu. Allah ya ga iyayenmu da mazajenmu don a cikin al'ummarmu su ba mu dama muna tattasa su gane.
So please do not be in a haste to leave the plenary session.
umme kinire to je nyedo tattauna da shi don baya yawan zama gida. Yawancin lokaci idan in ke saya mishi fensir da littafi, amma babana ba ya siya min don ba ma yawan yin magana da shi. Da so samu ne iyaye su dinga magana da mu don su san damuwar mu.
Consider lucky. My baby, let's keep on jamming. This fire cannot cool down. You tell me to snub me. Wish I don't know my baby. I don't wanna only go. Yeah, My thoughts, size. Go down my wine. Okay, that's it. My baby, you're my special one. My bestie, you're my soldier boy. Until you give up, calm down. Now your confidence, you bust my head. Take it easy. One for the road, keep it steady. Two for my girl to get energy. But the marketizing for synergy. Such a bad bitch, but the body. Keep it moving, or a body. My thoughts, perfect size. Go down my wine. Okay, that's it.
The hottest tunes, the hottest DJ. Latitude.
Trust me, but right now I'm feeling down.
Toasting a good life, living every minute to the full cause I could die. Pull up at the spot, open doors and it's suicide. Shit it rent me, when the check, please couple hundred G's on a good night. We can start it now, we can start it. Trust me, but right now, trust me, but right now.
Nobody did the way me give you water. Girl, I wanna be your lover. How the world like you be my daughter. Only you, girl, nobody matter. Chocolata, can't wait to take you to order. Treat you like a friend, kiss you like a lover. Steady with the vibe, steady with the lamba. As I enter the place, let me like you do, let me like you do. Let the fire move, let the fire move. Take a shower, do ya cash on a man. Now you can make me do, body to color me, do ya wind up your roof, I see you do, I see you do. Do me like you do. Nobody, do me like you do. Nobody, do me like you do. Nobody, do me like you do.
know KG.
KG. Okay.
Kokota, hey kokota, kokota, hey kokota. Kokota, hey kokota, kokota, hey kokota, hey kokota piano, that's a piano, I dance any piano, kokota piano. Hello, 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 someone on. Hello, 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 someone on. Kokota piano, that's a piano, I dance any piano, kokota piano. Hello, 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 someone on. Hello, 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 someone on.
pretty girls. Pull up in the Tesla, updates. I took it to get back to my yard. Gura no, take it. Pull up in the Tesla, boy. I got big girls. Pull up in the pretty girls. Pull up in the Tesla, boy. I took it to get back to my yard. Gura no, take it. Pull up in the Tesla, boy. Who them be? I dey party my jalopy, no back inside Abuja, no be play with my key, with my babe. She dey put on mascara and I get her, we dey cop the banger. Follow the stash, not a banger. Let me follow up with my kanda. New hello, content of abuse, pure happy, we go follow up with tracks. I bet, anytime, big girls. Roll with the pretty girls. Pull up with the Tesla, updates. I took it to get back to my yard. Gura no, take it. That's how you. They got big girls. Look, the pretty girls. Block the Tesla. I took it to get back to my yard. Gura no, take it. Tesla.
Got 3 cars parked in the yard. I know they have my face when I pass. Sally place, so they know when I pass. My dad for the first time. Yo, bad time, well, got me to jungle over. Keep me on, keep me on. She come my life, come carry my auntie, run over. Keep me on, keep me on. Waiting I don't do for you, waiting I don't do for you. She promised say you don't go, let me go. And last night you told me that it's all over. Keep me on. I want to buy you, walk beside you. I want to buy you, to call you my boo. I want to buy you, walk beside you. I want to buy you, to call you my boo. Baby, don't be so. Don't leave me go. Don't leave me go. Baby, don't be so. Don't leave me go. Don't leave me go. Lying on my bed, I'm just rolling over. Keep me on, keep me on. You can't get job life when I day sober. Keep me on, keep me on. Waiting I don't do for you, waiting I don't do for you. She probably say you don't go, let me go. And last night you told me that it's all over. Keep me on. I want to buy you, walk beside you. I want to buy you, to call you my boo. I want to buy you, walk beside you. I want to buy you, to call you my boo. Baby, don't be so. Don't leave me go. Don't leave me go. I know fit for some feet on pass my car. Roll up a shower, I get for papalata. I enter from my puta papalata. Only water cause you face me and water. I know fit fast, I know fit to pass my car. Roll up a shower, I get for papalata.
Ufo, Molana, on God. Let me ask God. I can fly, baby. But you're not shopping. I don't find interesting. Would you mind if you are my nigga?
papalata. Money monta kasu face ya wanta. I know fit fast and me fit don't pass my power. Roll up a shawarma, I get for papalata. I enter from a puta go papalata. Money monta kasu face ya wanta. I know fit fast, I know fit don't pass my power. Roll up a shawarma, I get for papalata.
For Molana, on God, let me ask God. I live flying, which I'm a shot, me come on, no, I come back, and you see, which I'm a Libya, manager, no, this time, tomorrow, shot, ease a cry, baby, don't you waste my time, what's my person? No, I see love, I did forget,
I enter from a puta go papalata. Money monta kasu face ya wanta. I know fit fast and me fit don't pass my power. Roll up a shawarma, I get for papalata. I'm doing a song, I'm doing that. Doing that, she pass me, I control me. I'm doing a song, I'm doing that. Doing that, don't need when the money is short like it. Getting rich and it's all in the plan, my mind ready to focus. I buy time for my baby, more don't you mommy, to rally. Softly living like a superstar. All I do is need till no more loss. See my diet got me gone. I just feel like what's the rush. And I waiting next up. Me not see no evil and I fear no one. I do the sign of the cross. For you the meat don't be done. Since I know the same for God. I'm on a new level, but I put it all on God. So when you see me smile, my brother, you for just show me love. Viviendo la vida loca, nobody take my joy. If I make way when you see your client. Easy money, money, money. Too much money, need. Easy money, money, money. Too much money, need. Let no be if I come up. Around my city, I boss up. I go home, me pay, I don't want to. You can start to be show the escort. But to this car, I go low. Make all the girls they go low. Isha Odua, send it to you. Isha Odua, you buy follow. All I do is make it to you, no one else. See my diet got me gone. I feel like what's the rush. Can I waiting next up? Me not see no evil and I fear no one.
Can we have everybody back into the hall, please? Can we please call everybody back into the hall? Let's restart our session for today. We are behind time, but we have a strategy to buy back the time. Trust me. So if you can have everybody come into the hall. We have rescheduled the plenary sessions in this order, and I would like partners and organizations responsible to please note that we will take plenary sessions in this order. UNICEF has 2 sessions, a 15-minute session and a 30-minute session, but they have told us they can do it in 35 minutes, the 2 sessions. So we'll be happy to have them call up their panelists and also for them to have the special guest on the 15-minute session available. We will take that now. We will take that now, back to back. That will run us to 3:30. That will run us to 3:30. Then we will have UNFPA for a 30-minute plenary from 3:30 to 4 p.m. And we'll have Girl Effect 30-minute plenary from 4 to 4:30, and Swag for 30 minutes from 4:30 to 5 p.m. And we will go for a late lunch and we will call it a day. We will go for a late lunch because breakfast was late. Lunch will also be late. We need to give you time to digest, correct? So please, the sessions will start immediately. Please, do I have representatives from UNICEF? Do I have representatives from UNFPA? Do I have representatives from Girl Effect? And do I have the representatives from SWAG? If they can just come forward and occupy the first row of seats so that we know that our panelists are here. And as soon as we get into the flow, we will take it back to back to back to back so that we can manage our time. So please call in partners that are here. Please call in your colleagues. We may not be able to change our timing. We hope we don't get to miss any session. Everybody outside, please come in. LOC, please help me. Let's shut down the exhibition booths. Let's pause on that and let everybody come in. Let's go to the dining halls and ask people to come back. We'll start in 5 minutes. Let me just go out and encourage people to come in. DJ.
Normally, they know they see me for party. I dey sip my tea, protect my peace, I no send nobody. Energy, it dey show for your body. When you call on me like Doremi, oh yeah, I'm on your baby. Oh, see ready, body me don't say party. I want just want you body. Tell us up, oh see body. I don't sabi. Come on, some party. Anything that they like, anything that they want to see. They come here. Get money for any day. Every day we celebrate. Feed the pray make a face. I dey pray for you. A lawyer dey win any case. So whether you mad or you crazy, I know they follow you race. I did my own day, minding my business. Oh, now the work of the pay me, oh, and the face on the daily. I just do my katana, I don't want your palava. My business,
sleep for the community I compose. And when I pull up on me I support. From the end of the days I'm bored. If Santa Claus I got
get money for any days. Every day we celebrate. If you dey pray make a face, I dey pray for you. I love dey win any case. So whether you mad or you crazy, I know they follow you race. I dey my own day, my business. Oh, now the work wey dey pay me, oh, and the face on the journey. I don't like you, my business. Yeah. Sinya nang kau pati na hau patatan tola kape iposa kubita ore e amore uso fitileng chatate fika kau sinya nang kau pati na hau patatan tola kape iposa kubita ore e amore na wabona kula sekele hompona so fitileng ako ya manyora upafela sabela mpora ipimeza kana na wabona akishapa kusete tamchari ya chita iluse dimora kela nakitele tedi focus vele na kiskele matabuka kishapas kusete tamchari ya chita iluse dimora kela nakitele tedi focus vele na kiskele matabuka kinoma au kuza batotina which busy hima twetata yebi yeso kika tweta kinoma attack
to them and advise that they come back into the hall. We're about to begin the first will last for 30 minutes and the second would also last. Okay, both will last for 30 minutes, 15 minutes each. The plenaries outside, kindly come inside so we can get back on track. Thank you.
So we'll move on quickly with the session for UNICEF, and we're going to have the moderator from UNICEF. Can we put our hands together for Dr. announced earlier so that we're able to meet up with time? Thank you.
Hello. Hello, Sayphin 2025. Hello, Sayphin Garden City. I work with UNICEF. I'm the health specialist, and I'm excited to be your host for the next 15 minutes. It's a short session, but it's going to be very electrifying. The session is tagged The Journey of a Pregnant Adolescent in Nigeria. And first is a young adolescent from Kaduna State. And we need Dr. John Ovurai from Gashi, the head of the Federal Ministry of Health. Help us to call him. And the third person to be with us in this session, I need the drums to roll. She is the delectable UNICEF ambassador par excellence. She is a singer. Where are the adolescents? She is a singer, a songwriter, an advocate for young people, an adolescent health expert. Our very own Waje. Thank you. So we are going to go on with the session. While we, somewhere in between, Dr. John will come to be with us. I'm going to hand over the microphone quickly to you, but before then, I just want to set the stage. In Nigeria, we know that adolescent pregnancy is a reality. Everything we need to do, we try to do to prevent it, but it still happens. From the statistics that were reeled out by the Honorable Minister's representative and many other people, about 2 million adolescent girls have gotten pregnant. So how is the system treating them? Because for an adolescent, whether in or out of marriage, there's something that needs to happen or something that is not happening. We have a lot of things happening to them, and today we are going to have Waje talk to us experientially of what 2 minutes video clip, and the young people will respond to it, and we'll also hear from the Federal Ministry of Health, and we'll conclude with Waje. Waje, over to you, please. Please put your...
Come on now, ladies and gentlemen. Thank you so much for having me. I stand here today not just in Nigeria, I'm still working. The journey of becoming a mother while being a child. When I was a teenager, I faced moments of fear, uncertainty, and isolation. But I was also blessed with people. What if every young girl had that chance? A chance of health services not being a privilege. Health services, mental health support, and even the right information. And yet, we know that the right systems are in place. with the right systems in place, I beg your pardon, their stories will be different. This is why this conversation matters. Data is more than just numbers. It's a mirror showing us how we treat our adolescent girls. It tells us where the gaps are and guides us towards better solutions. Data only changes lives when it is used, when communities, leaders, and young people work together. So as we begin this session, I want you to listen, not just with your ears, but with your heart. The voices you hear today from our young people is proof that when youths are engaged, they don't benefit from the system only, they build them. Thank you.
Please it's just 2 minutes.
At just 15, her world changed. Pregnant, shamed, alone, forced to leave school. She needed care, but the health worker mocked her. She needed food, but had barely enough. She needed school, but pregnancy meant silence. No midwife, no ambulance, just pain, fear, and a crying newborn. But her journey could be different. She could be welcomed, given antenatal care and nutrition support. She could go back to school or learn a skill. Protected from abuse, given a chance to thrive. Every girl deserves support, not stigma. Let's invest in her journey because
her journey and responsibility. So how have we been supporting, involved in, and as a young man, what is your perception on how a pregnant adolescent should be managed or how they've been managed and supported across different areas of life, education, family, religious groups? Tell me what your perceptions are, please.
Okay, my name is Alhassan Alhatu Zelani. Thank you, UNICEF, for this opportunity. In my perception, generally in the North, is of two phases. The adolescents in the North are encouraged to marry early, but as we know, pregnancy comes with a lot of responsibilities, changes in the mindset and the body, so that they can have a wonderful pregnancy and wonderful outside the marriage in the North, not encouraged. Adolescent girls, we counsel them to avoid pregnancy that is not wanted.
Yes. Thank you very much, Alhatu. I'll come back to you.
All right.
But,
yes. Okay. Thank you so much, Waje. I'm Rabia Busari, a UNICEF young leader promoting HPV vaccine and adolescents. I'm very sure every year, but I have a parents themselves.
Wow. It will be, and that's why community, I'm human to you, regardless of what the story, it's great to have and with the will to do comes accountability. Because these girls, like you, believed in me regardless of the situation. My daughter is 26 years old. She's a graduate.
Wow.
And the young ladies.
Thank you so much. I'm very sure everyone has
Thank you
heard
very
that.
much, Wade. Let's be the Ministry of Health strategically.
And thank you, the adolescents. And I'm particularly happy and excited to be here. Ministry of Health interventions at the federal level. It's something that plays out every now and then. 15 that was a facility. She was attended to, comfortable to go to the facility. So health angle. We want, and then the ones that prove a lot of drugging them of these things happening in our country in our life just.
It's actually just a teaser from this session.
You never leave a pregnant support from the family, the government, and everyone. Thank you.
Thank you very much. It takes a community.
Okay, mine is.
It takes a community.
Okay, mine is table to make our own decisions. We adolescents, we need the seat at the table to make our own decisions.
Statistics into stories and stories into systems so we can help our adolescents. It's not just, oh yes, let's sit down and talk, but let it be real stories where you see testimonials like myself for a lot of adolescents. And yes, we're talking about girls, but we also are there for our boys as well. You understand? Because this is not exclusive to only girls. So thank you.
Thank you very much.
So mine.
Thank you very much.
So mine is the peer influence, just as for them to uphold. We are there for them. Thank you. We are there for them. Thank you.
Thank you very much. And with this, we come to.
Even if you cost me trouble, I won't let it.
From this part and the other from here. Okay, I'll get the mic down to you. Meanwhile, right after this question session, the next plenary with UNICEF will be moderated by Anike Ali Hakim, the communications specialist with UNICEF. Kindly get ready.
Thank you, UNICEF. My questions, I want to direct it to the Federal Ministry of Health, please. I've been in facility for years, working at the grassroots. And one of the things I know is the closest hospital to adolescent pregnancy most. You cannot admit, you cannot book a 15-year-old pregnant adolescent. It is not safe. They will always encourage that if you have those cases, you should refer them to secondary health facilities. So my question is, please, what is Federal Ministry of Health is doing to ensure that PAC are being equipped, especially with skilled birth attendants, midwives, that they can take care of this pregnant adolescent? Sending them to far away facilities, they will not go. They will resort back, going back to their houses and put to bed there, and anything can happen. Thank you.
So thank you very much for that beautiful question, a very good one. Actually, there's no much time. You know, a journey of 1,000 might begin with a step. Country is so large, so many challenges are everywhere. But not expected to go to the same facility the mother will go to. Because this time around, they have a health care provider. That is, first of all, the structure. That means that there should be a center or a friendly clinic which pregnant adolescent can go to. Two, the human come here, we need to attend to her. And they've been trained on how to attend to them. And so that after their delivery, their baby is okay, they can even go back to school. These days, we are encouraging at the federal government, Federal Ministry of Education have also passed the policy that back to school, second chance, they have it. So it is at that point they will tell them that you don't have to drop out of school, you can also go back to school. And then siting it close to where they live. That is the target of into secondary facility, into PHC, because the PHCs are closer to the people. And don't forget, the government is also on the aspect of revamping our PHCs, so that at least a functional piece that many more will go, and gradually, slow and steady, we will get to where we want to be. Thank you very much.
Okay, so to her to give you that feedback and then talk. Okay, the challenge is that according to popular opinion over here, these things you have said are only on paper, and what we see in reality is completely different. So is there a way to give feedback to the government? You earlier said government has done a lot for adolescents. Adolescents need to do something for governments. Now we're speaking, give a feed. Like, what do we do?
We have what we call the Adolescent Health Development Technical Working Group. Work with them. But it's almost impossible to get all the adolescents across the country to be in one meeting. That's why platforms and forums like this, the Sayphin conference, plays a role. They can hear me now, knowing that they are being represented at the TWG. And not only that, states are also having their own TWG on adolescents. And all these things are ongoing. So, given the voice that you have asked for, the voice across, your location, you may not have one facility nearby. But if you look very well, there may be another facility that is not too far away. But it may be something you need to pay 1 or 2 times to get there. It's something we can discuss later on, but I can assure you it's inclusive. Thank you.
Okay, thank you. Let me add a voice to my colleague. Just to say that the federal government of Nigeria, Federal Ministry of Health, the adolescent age group, yes, you will receive care at all levels. However, it's with respect to your condition. Teenage pregnancy is a high-risk pregnancy. And PHCs are not equipped to handle it age range. So the healthcare worker there is a skilled birth attendant. You will adequately assess her and give her the best care. Quality care is what we stand for. Because you want her mother happy.
For our last question, I would really appreciate that you take it in 30 seconds. I hope that's possible.
Okay. Good afternoon, the Ministry of Health also. So, you mentioned something about an adolescent being raped, that the pregnancy may occur as a result of rape, right? And you also mentioned something about youth-friendly services at PHCs and government hospitals. So what if this adolescent doesn't want to keep the child from a rape? What are you saying about the abortion law? Thank you.
Thank you very much. When you picked up the mic and you wanted to ask your question, I was telling her that this question is directed at me. Because I know that it's very Minister here today and the adolescent. Thank you for the question anyway. So, for the age of consent in Nigeria, based on our own, the law is 18. 18 downward, then still a child. So when it comes to issues of rape, and when it comes to issues of abortion and safe abortion, the Federal Ministry of Health also have this. I'm not allowed criminal abortion every nook and cranny. But safe abortion, there is a law to guide that. So for your question, for a case of a baby that is raped, we will want to engage that particular baby, depending on the age. Then 2, you also want to cancel. And after canceling, then you may take it away from there. But in the Federal Ministry of Health, we already have what we call gender-based violence, management of survivors of gender-based violence. And rape fall into gender-based violence. Meaning that apart from engaging that particular person, we also want to make sure we take forensic evidence so that we don't lose. So we normally take the forensic evidence, we keep it. And all this evidence depends on the part of the body the violation take place. Is that anal, is it mouth, is it too close, anything, we take the evidence to keep. Why you cancel? Wait until when they are willing to prosecute, so you have hard evidence to be able to convict medically, to be able to convict that particular person. Then decision does not rest only on that adolescent. It also rests on the entire family. And a good counseling session does not end in one encounter. It may be a follow-up encounter. So I won't be able to tell you conclusively that, yes, I will have an encounter with that patient and then that particular survivor, and then it's all over. No. It may take multiple actions, and after some time, the person may say, I want to prosecute. That evidence that I took when the person came is now available for them to be able to prosecute. So it's a thing that will involve the family, will involve the particular adolescent that is involved, and the healthcare provider must be sound with adolescent GBV kind of training to be able to support them all the way. Thank you very much. That's how we put it. Thank you very much.
Thank you very much, sir. This lady has an observation, so we'll just take her observation in 30 seconds.
Good day, everyone.
I'm Zakia Sayyid Abdul Qadir from Kaduna State. I'm an advocate of maternal and child health, and first and foremost, please, I want to show my appreciation to UNICEF for sponsoring my transportation here. So, one thing I want to talk about, the video just inspired me and arose what we see within the community. The video shows this woman is pregnant. We do not even know how she becomes pregnant under gender-based violence. Sometimes she is maltreated. She knows she needs to talk about this, but she doesn't even want the world to know how she obtained that pregnancy. So either an adolescent he's disciplined himself with, give them the face help. Thank you so much.
Thank you very much. Can we get the photographer? With UNICEF coming up shortly is the second session, plenary session, still with UNICEF. And that will be
on to welcome our AYP from Kwara, Fauzia Alaya, to the stage, please. Is Fauzia in the hall? Following up with Fauzia, we have our AYP from Sokoto, Abdulatif Abdullahi. Please come up to the stage. Along with him, we have our AYP from Adamawa, Egla Daudaga. Please come up to the stage. I would like to welcome our member of the European Union Youth Sounding Board, Emanuela Eze, to the stage. Please make welcome the Chief of UNICEF Bauchi Field Office, Dr. Nuzat Nafik. We also have on this panel Dr. Andrew Kirima, Head. Please welcome the Director of Family Health Department, Federal Ministry of Health, Dr. Binyerem Ukai. And last but not the least, Imam Ramen from UNICEF Nigeria. Lovely presentation delivered by our very own Dr. Vic. And then we will start the conversation properly.
And some of the speakers. Please let me the scope, what the EU SARA initiative is all about. SARA, and many to reproductive of the EU, with funding from the EU, technical support from UNICEF and UNFPA, and under the leadership of the Federal Ministry of Health. It's a national agenda. It's just that these are the people that are facilitating it. It's nested within what the national adolescent health response is all about. So it's a 48 months initiative that's 4 years, and it started last year. So next slide, please. Why are we doing this? I'm not going to go into details, but basically, because from the last session we had, we saw what the issues are. Weak systems for supporting adolescent girls through their journeys, sexual and reproductive health journeys. The health system is already weak. Societal and harmful practices, low demand and accountability, the loss of stigma and all that. Next slide, please. So that is the problem. So, and to address this problem, SARA was conceptualized with support from the EU. And basically, in a nutshell, this initiative is supposed to support government, strengthen the system, maternal and child health, because Nigeria is this country with the worst indicators for mortality. So when you look at the statistics, a lot of this maternal mortality, death of mothers due to pregnancy and newborn death is attributable to adolescent pregnancy. So we need to do something. So that is the proposed action, is to drive sustainable and predictable financing for maternal, newborn, child, and adolescent health. And GBV, we say we bring out GBV because a lot of the adolescent pregnancies happen from one kind of GBV or the other. So the proposed action is what we have come up with as Sarah. Next slide, please. So the specific objectives, there are 3 specific objectives. I'll just say one is about building institutional capacity of the Ministry of Health at the national level and at the state level. Now, I shouldn't say building because we're not starting from scratch. Strengthening capacities for planning, financing, having all these questions that have come up. This is going to help to address it. How do we ensure that facilities are addressing this? How do we ensure that capacities are in place? Strengthen service delivery at the facility level, secondary and primary. And third, that's the second objective. While the third objective is about data, ensuring that there's institutional capacity for health information management so that when these interventions are happening, they will be well documented and to be recorded. We will know when we're making progress, where are the gaps, and what needs to be addressed. Next slide, please. So I'll skip this because of time. Of course, at the end of the day, we are hoping that when this intervention happens, then we'll see reduction in the indicators, reduction in the maternal mortality, reduction in newborn mortality, reduction in teenage pregnancies, and all that. And just to say, this slide, what it's telling us that it actually aligns with the government plan. We have the new reform, health reform, by the Federal Ministry of Health, and we're ensuring that it is nested. That's why we're not calling it a project. We're saying it's an initiative. A project starts and ends, and for 3 years. It's supporting the national level and 3 states, Sokoto, Adamawa, and Kwara. So those are the states that this funding is supporting. Hopefully, we're going to get scale up by the federal government when we see that this is working, and then there will be more commitment. Next slide, please. Next slide. Here. Just to show the organizational mechanism that, again, it is nested within the federal government, within the states. There's a national committee, steering committee that is headed by the Minister of Health. Already, so the coordination of Sarah has been taken out, even out of the project, and it is now at the Ministerial Oversight Committee. And then we have state people, we have the focal persons at the state that are taking care of the normal state programming. They are the ones that are in the center of coordination. This is to ensure that there's sustainability. So this is not an initiative that will start and end, but to strengthen the system, and even when the funding is gone, it will continue to provide results. Next slide. Just to say that the inception started last year, and we are still at the early stage of the initiative. We're not going to even attempt to start telling you about the results yet, but I can assure you a lot is already happening. Capacities are being built, facilities are being reorganized, renovated, young people are being engaged. A lot of young people, some of them here, have already started seeing the dividends. So I'll stop here so that we can continue with the session.
Thank you very much, Dr. Victoria, for that great presentation. And you've led me directly into my first question. You've talked about not going deep into the results that we've already achieved. So I want to throw a question to one of our AYPs. You know, they are the last mile. They know if we're telling the truth or not, Dr. Victoria. I'm looking at you. So, Egla, since the EU SERA started in your state, Adamawa State, what are the results you've seen? What has changed for adolescent girls and adolescent health, not only girls or boys as well, in your state since the initiative started?
Hello, everyone. My name is Egla Daudaga. Firstly, I want to say thank you to UNICEF for giving me this opportunity to be a part of this conference. Since the EU SARA project has started in my state, a lot has changed. There was a great development when it comes to the adolescent health. Firstly, in all health clinics, or rather health facilities, there are safe places where it was segmented for adolescents. They can go there, lay out their complaints to a health worker, and counseling session will be carried out, whereby the counseling session is always confidential. If you go there, there is no need for you went there. Secondly, permit me to say adolescents in my state are now health promoters, because they involve adolescents in the called polio vaccine. We create awareness on it for parents to allow their kids get the vaccine and all of that. There are also opportunities whereby we create awareness through the radio stations, because most people in the rural areas who get this information maybe through the radio settlement, it has been expanded also into the rural areas, consisting of all the 21 LGAs in my state. So therefore, the rural settlement are also not left behind. And even us, the adolescents that have an idea about it, make sure those in the rural areas or those that are not opportuned, we go to a lower level in order for us to explain to them, for them to get a clearer idea about it. So therefore, Adamawa is really doing well when it comes to the health facilities, since the EU
Right Honorable Speaker has been non-judgmental. So,
and that's bringing adolescent health to the foreburner. And this also in alignment with the call at the regional level for WAC, Women, Child and Adolescent Health. So Nigeria, from the Federal Ministry of Health, have keyed into this and is taking lead on this. And I also want to say that the Federal Ministry of Health is moving this forward, and policy-wise, ours is to create the right policy environment. So that is already existing. And again, to facilitate implementation. And we are very happy of a huge opportunity that came to us. Amidst all other interventions on adolescent health, came the EU SARA initiative, strengthening access to sexual reproductive health of adolescents in Nigeria. And if we recall, the sexual and reproductive health needs refer to all matters of the reproductive health system, refers to from pre-pregnancy, pre-conception period, when she's still a young adolescent, take care of her, offer her the necessary interventions, be it even contraceptive use, to when if she gets pregnant, she's a mother now, throughout the pregnancy to delivery, to after delivery, ensure that her maternal health is well covered, even post-delivery, ensure that her because it's a continuous cycle. But now, the SARA initiative is focusing more intensely on the adolescents, because they are on their way, to making progress, even to getting to adulthood. And through the SARA project, as has been already spoken, the Federal Ministry of Health has been collaborating very actively with the SARA project, technically supported by UNICEF and UNFPA. And we are working together with them to ensure that we improve coordination of all adolescent related interventions. And of course, within that whole compendium, you have gender-based violence, you have rape matters, you have all the others, all put together, mental health and all that. And we are ensuring that what the EU project initiative is bringing is being institutionalized, and we become our priorities. And so the government already has prioritized their coordination mechanism. And so we have what we call the RAMCAN plus NTWGs. At the national level, we also have the RAMCAN CTG as well as the SWAP TW.